to teach you something. So treat every patient as such. Say for example, you're a medicine postgraduate, you're managing a case of diabetic ketoacidosis. Today you're on duty, you get a DKA patient admitted in the night, you admit the patient. Next day, or on the job, I mean, when we were doing PG, we never had this luxury of having, internet at our fingertips. We had to go to the library, take out Harrison, search for DK, take a notebook, make notes, again go next day and read it. Today, you want to read about DK, as you're managing the patient, you can just pull out your mobile phone, read about it. Download articles, make a folder. What I used to do during my DNB days was I had a folder where I used to save all the reference articles. Say I see a patient with a STEMI, first day of DNB cardiology, I see a patient with a STEMI taken up for a primary PCI. So what is primary PCI? You Google it, you come across review articles from standard journals, download them, put them in the folder. Whether you get time to read them or not, put them in the folder. End of 3 years, when you're preparing for your exams, you won't have the hassle of having to search for all those articles. You want to read about STEMI, you go to your folder, you will find 10 articles over there. You want to read about heart failure, you will find 10 articles over there. So read on the job. Whichever patient you manage, read about that case. So the next patient with DKA which you see, the next patient with STEMI which you see will not be the first case. You would have already read about it. So that becomes your revision. Similarly, for any field, anything, obstetrics or pathology or physiology, whatever thing, of course, non-clinical and clinical things, paraclinical things, it's a different way. You will probably get more time to read over there. For clinical fields where your intensive fields like medicine, cardiology and your, broad specialty surgery and anesthesia, orthopedics, where you're not going, pediatrics, obstetrics, we're not going to get any time to even breathe or sit or have 2 square meals during your duty. Studying with a textbook might be difficult. So when you see a patient, read about that same case. Today it's easy. You have mobile phones, you have tablets. Have a good read about the patient wherever you get time. You're sitting and eating your lunch, you've seen something in the morning, instead of just watching reels on Instagram or scrolling videos on YouTube or Facebook or whatever it is you guys see these days, read about it. You have UpToDate, you have Medscape, you have many resources available. That is the best way you can read as a postgraduate. And believe me, at the end of 3 years, when you take your textbook and start reading, nothing will seem new to you. At least 70 to 80% you would have covered by reading these day-to-day topics. There will be 20-30% which is left, which you will obviously read up during your preparation time. But if you are just going to blindly treat patients without reading, it is going to be like, like Osler said, sailing in a sea, in an uncharted sea. When you're treating patients without books is like sailing in an uncharted sea. But studying medicine without patients is like not going to sea at all. So you're at sea already when you're seeing patients. Now you need to chart your sea by reading books. So whatever case you see, read about it. That's the best way. That is my way to do it.
Thank you so much. As you pointed towards the usage of internet and resources, I would like to ask, when there are so many resources at the fingertips, there's ChatGPT and there's AI, don't you think that it will blunt the aptitude of the student, that every information they are getting, and earlier, as you said, we used to refer textbooks and all, and now the information is available. So that urge to search and to think and ponder and to analyze critically, don't you think that an approach which does not have a specific direction of using these resources, can it affect the aptitude of the PGs?
That's a very good question, actually, because my brother-in-law is into AI, and he told me, in a few days Google is going to replace you. I said, really? That's very good. Let Google try. See, because AI has its limitations. They say that, we used to ask students, what is the most important part of a stethoscope? Can anyone tell me? The most important part of a stethoscope? Yeah, it's the part between the 2 earpieces. Okay, so you might hear murmurs, you might hear heart sounds, but unless you know how to analyze it, there is no use. So whether you're using a Littmann or you're using a microtone, doesn't matter. You can use a microtone. If your hearing is good enough, you might still diagnose mitral stenosis. You might use a 30,000 rupees electronic Littmann and you might still miss it. So ultimately, every resource is like that. The fact is that you have so much available, but now it's a double-edged sword. You also have a lot of wrong information available. So there's a lot of misinformation, probably that's a better word. So you need to know what to search for and where. Now, even if you look at ChatGPT and AI, the answers depends on the prompts which you give it. The more thorough, the more accurate your question, the more thorough and accurate is the answer you get. You ask it a vague question, it will give you a vague answer. So we need to use these things to our advantage. So use it as a form of research, but also at the same time know where your information is coming from. Like they say, there are so many, when you start practicing, you will see pharmacological representatives come to you with their own monographs, and they will say, like, initially in the days, I'll give you an example, when SGLT2 inhibitors became big in heart failure, everybody was saying that empagliflozin is great and dapagliflozin is great and all of that. And the fact was that when they did two studies, the study with EMPA showed a definite mortality benefit, but the study with dapagliflozin was negative for mortality benefit. It did not show a mortality benefit compared to placebo. And it only showed a reduction in hospitalization without a reduction in mortality benefit. That means patients were dying anyway, even though their admissions for heart failure were reduced with DAPA. But with EMPA, there was a reduction in both. Now, the problem here was DAPA was off patent. EMPA was still in patent. So very few companies had the empagliflozin molecule in their portfolio, but majority of the pharmacological industry had DAPA in their portfolio, and everybody was trying to push DAPA into practice. So all pharma reps started coming saying that dapagliflozin reduces heart failure, dapagliflozin reduces heart failure. So if you don't know where the data is coming from, you will blindly say, okay, it reduces heart failure, let me prescribe it. But the fact is, it was an inferior molecule to EMPA. Of course, after that, a lot of studies came, a lot of these things came which said that that was a one-off, and now, they are both taken on par. But this is just an example to say that not everything is as it seems. So you should know how to analyze a research paper. That is where SPM comes in. That subject where everyone used to sleep in class? Yeah, that's the one I'm talking about. What is p-value? What is odds ratio? What is the strength of a study? What is the strength of an observation? You need to know these things, because when you search, for example, on ChatGPT or AI, it will tell you that there is a significant difference. But what is the strength of that? What is the p-value there? What was the odds ratio? How significant is that? So these are things we should be able to apply as well.
Thank you so much. I would like to direct this question to Dr. Usama and Dr. Afra. You have a wide range of academic qualifications. So while doing one specialty, still having the urge to do further and go for other degrees as well, how do you keep that urge alive after getting into PG? Because in the first 2 months, people start to say that this is the last, after this I won't attempt any more competitive exams or anything.
Assalamualaikum. First thing is, if anybody has that urge, I sincerely urge to kill that urge. Because the thing is, it seems very rosy that they say grass is always greener on the other side. So if you're into one subject, if you take, suppose my case, I've taken anesthesia in the beginning. At that time, I had this in my mind that I did my UG from Shadan. I didn't learn much. Anesthesia is a multidisciplinary branch. I get to meet people from different branches. I learn a lot. That's what I thought. After entering into anesthesia and practicing it for 1 year, I had a unfortunate case where a gynecologist tried to do something. Patient died. And after that, I thought that this branch is not for me. Then I again went for PG admission and all that. So what I'm trying to tell you is, once you're into the PG, whatever you have to decide now, before getting into the branch. Once you take any branch, may it be biochem, may it be general medicine or any other branch, once you're in, that's it. If you are going half-heartedly into one branch and thinking that you're going to do justice, or you'll complete this 3 years and again join branch of your choice, that's not the way. That is going to waste your precious 3 or 2 years of your life. So whatever you have to decide it for now, whichever branch you want to take. It's nothing like some branch is superior to the other. Whatever branch you want to take, you can excel in that branch. I mean, there are a lot of pathologists, lot of biochemistry people, lot of non-clinical branch people who are earning a lot more than what radiologists we earn. So one thing I want to make it clear that never ever go into a branch thinking that I'll finish off these 3 years, I'll have some stipend, and then I'll read my branch of choice. That your branch of choice won't come after 3 years. The number of years you try and attempt a PG entrance, the chances of getting into it decreases reciprocally. I mean, you are very less likely to crack PG entrance if you try it more. That's what they say.
One more thing is, in olden days, there was a chance that you will do 2 PGs. Okay, nowadays, they have made a rule, you can practice only 1 PG. So don't waste 3 years of your life. Okay, in fact, a doctor, for example, if he wants to do a law, my husband, he has written law entrance, he is a orthopedician. So he thought, I will fight all the cases of all doctors. Okay, so he wrote the entrance, he got 120 rank in Telangana. He was getting into Osmania University. Then he came to know that he can practice only one, either law or either medicine. Okay. He went and spoke to some other college people also, and they told, okay, you need not come. Just write the exams. We will give you the admission. But what is the point? He can either be a lawyer or a doctor. So now they have made it, demarcations are very clear now. You can practice, if you take 2 MD, you can practice only 1. Okay. Regarding my wide range of degrees, it is out of my interest I have done. Most of them are child care related, nutrition related, okay, psychology related. This is all for my kids, okay, not for practice. So that these were like not time consuming, of my interest, so I have done. It is like my hobby, you can consider it is not for practice. So don't take these things as example. If you have free time, you can do something for yourself, but don't go for double MD. You can do DNB or DM, okay? That is better. It will add to your field of specialization. And rest all, I think what sir has said is more than enough.
Okay, thank you so much. How to select a field? I would like to ask Dr. Shadan Khadri. So when we were in MBBS, Dr. Tamim Saif, I think you all might have heard of him. So in one orientation session, he said that in South India, there is only a single female urologist who lives in Bangalore. And now we see that there are upcoming female surgeons and urologists, you yourself. So how did you get into this field, and what advice would you give female aspirants who want to get into different fields? What are the criteria for selecting a field? How much you look for societal requirements, how much you look for your own skills and all?
Well, the thing is, any subject usko choose karne ka, it should be driven by your passion for it. So before joining MBBS itself, I knew I would want to become a surgeon. So that was the driving force. But I'll tell you a tricky story there. By the time I got into my PG, before my PG entrance was only I was a mother. I was a mother to my 15 months old daughter at that time. So it was kind of ke karo nahi karo, surgery is very demanding, kaise karenge, night duties rahenge. What time PGs were not many that time. तो वो डायलमा चल रहा था, and then I thought I'll settle with ophthalm, I'll settle with derma, something like that. And then on the very day of my counseling, I had a discussion with my husband, like that was a physical counseling 10 years ago, and I was inside the counseling hall. I gave him a call. अब मैं क्या करूँ आप मेरे को बोलिए. I'm like, मेरे को समझ में नहीं आ रहा because it's the last session of the counseling. He said me a very good point. I think everybody should note that. He said me, "Ke Shadan, do whatever you want to do. This is the time you decide. आपका दिल क्या चाह रहा है. आप वो करिए, and rest assured, I'll be there for you to help in whatever way I can." And I'm like, I closed my eyes and I'm like, I always wanted to be a surgeon, and there's a seat for surgery in Osmania. Why will I not take it? Definitely I'll go for it. And it's not that he just said it, he meant it and he did it. He was always throughout there, like, my support. So I owe a lot to him. And then, as you said, this surgery ka to was only my pure passion. And I tell you कि आप passion पे ही जाएंगे, then only you can, go through the intense phase of your training. Because आपको many times ऐसा होगा कि ये छोड़ देना है thing. ये बहुत ज़्यादा hectic हो गया, अब नहीं carry कर सकती मैं. But again, you go back to it. Why did you start it? It was your passion. You wanted to be known as a surgeon, and that's how you started it. So it should be driven by your passion. So my general surgery definitely was driven by passion. But the second question, as you asked, it was societal चीजें कहते क्या? once I came out of the general surgery, what I observed was that I was not doing some intestinal resection which I did in my post graduation or my senior residency. All I was doing was breast lumps. All I was doing was proctology, and then I realized that okay, it's not that you are going to cater to everyone. There is a section that you are going to cater to, and that's how I'm broadly known as a proctologist. Because मेरे सारे if I see 10 OP, मेरा 8 OPD मेरा pylorus fistula का रहता और ब्रेस्ट का रहता उसमें से एक आध. तो उसके बेसिस पे that is how I decided the urology. Because when I decided I would do urology, I did not know a single female Muslim urologist जो थे या जिससे मैं guidance ले पाता. So that was all driven by the societal thing. कि okay, females की urologist कोई नहीं है, so I have to do it. So that is how I made this decision of urology. And I think आप कोई भी decision बना रहे हैं तो आप उसको पीछे passion driven रखो. अब यहाँ पे भी मेरा intention था कि okay, I can cater to many people of ours who would not be, very much happy to go and, get examined by a male member. So that is what has driven me to do urology.
Thank you so much. Dr. Sadiq Azam sir, since your SRship, we used to see how you were passionate with teaching youngsters about ECG and cardiac cases. That was the time before you went into cardiology. So how did that passion build, and how do you find satisfaction in the field? Because people go into field their department, they had a passion once, but after different circumstances based on the institute or the colleagues, they don't find that satisfaction anymore. And how do you advise the young PGs to maintain their satisfaction or to search for the satisfaction throughout their field?
Thank you, sir. Firstly, I think Madam has summed it up very well. Probably there's nothing more to be said after that, because I said the exact same thing. I mean, I probably say, post-graduation is like getting married. You get married for the wrong reasons, your life is hell. You get married for the right reasons, there can be nothing better than that. Similarly, you pick a postgraduate seat for the wrong reasons, that's it, you've had it. You will hate every day of your PG and you'll hate the rest of your life. Then you will end up saying that, let me do specialty. Then you will pick a specialty for the wronger reasons. Then after that you have nothing more to do, and then you will get frustrated. So don't do that. Do something that you love. My MBBS classmate used to say, pick what you love or you'll be forced to love what you pick. So ultimately, see, I think if you remember, there was a time when I was preparing for my super specialty. A lot of people are telling me that, you should do gastro because there's a lot of scope in gastro. Of course, they didn't tell me that the scope was endoscope and colonoscope. But then when I was sitting for my, when I was going in for my counseling the night before spraying istikhara, and I was really confused because a lot of people, everybody was saying, cardiologists both hai, there are a lot of cardiologists, there's so many cardiologists. You throw a handkerchief, it will fall on a cardiologist. You sneeze, it will fall on a cardiologist. Right? But as Tala would tell you, when I used to take classes for them, and the amount of passion I had for teaching cardiology and for examining a cardiac case, I could never get that passion for any other field, for any other field. So when I asked myself, what am I going to do for the rest of my life? I mean, this is something I'm going to do for the rest of my life. What will I be happy doing? And that's when I decided, no, whatever it is, let there be many more cardiologists. It doesn't matter. I'll be one amongst them. It's okay. But I will do this. And Alhamdulillah, I thank God every day that I made that decision. Because no matter which field you pick today, if you're planning to settle down in a city or even if it is a second tier city, it is saturated. There are a lot of people in every field. The only way you will shine is if you're passionate about it. I mean, until 5 years post DNB, after doing sub-specialization into device therapy, etc., and I was still doing nights, I was still doing Sunday shifts, I was still running in the middle of the night for emergencies. Even today, I run in the middle of the night for emergencies. But I'm never upset about it. I'm never sad about it. I never get frustrated about it. I mean, I might be tired and just come home and I might get a call that there is an MI, there is a primary, you have to come back. And it's okay. I'll go back happily. Because that's what I want to do. that's what I wanted to see myself doing, alhamdulillah, and I'm happy about it. I've never felt frustrated about it. So ultimately, if you do something that you're really passionate about, you will not mind the long hours, you will not mind the the grind that you go through the 3 years. Otherwise, as madam said, you will feel every day, "Arey bhai, this is too much, I can't do this." You see people quitting, people join good seats and then they quit because they say, "Arey, we never thought it will be so tough." But when you join something that you really are passionate about, it doesn't matter. It doesn't matter how tough it is. You have to work 18 hours. People were cursing Narayan Murthy that day when he said, you should, Indians are not working hard enough. They should work 70 hours. It won't matter whether you're working 17 hours or 24 hours in a day. You love every second of what you do. Because remember, that is what you're going to do for the rest of your life. It is not one day, it is not 2 days. It is not like Usama said that, after 3 years you can feel, ke, chalo bhai, I'll change it if I don't like it. No, you pick something which you're really passionate about. Money is not the criteria. Don't join a field for the sake of money. Don't think ke, bhai, ye field mein paisa hai. Paisa medicine mein hai hi nahi. Okay. I remember. I'll take another minute. I'm sorry for the long thing, but when we were junior consultants in KIMS, after passing out, we joined back as junior consultants, and a new batch had just joined in. So we had a meeting with Dr. Bhaskar, who was the MD and CEO of KIMS. So he was asking our juniors, why did you pick cardiology? So one of them said, for the sake of money. He said, you first resign and go. You want to make money, you meet me later, I'll teach you how to make money. Don't join medicine for the sake of money. Okay? Join medicine because you're passionate about it. Join medicine because you want to make a difference to someone's life. Money will come. If you're good at what you do, if you're passionate at what you do, if you work sincerely, you do good work, you do honest work, you do ethical work, God Almighty will bless you with risk. Whatever money is written in your fate, not 1 rupee more, not 1 rupee less, you will get it. You have to have that belief. You will get it. It is written for you, it will come. Don't work with that as your end goal. Don't join a field with that as your end goal. Join a field that you're passionate about. Success, fame, money, all that is written in your fate. It will come. But if you join something for the wrong reasons, you will become unhappy, you will get frustrated, and trust me, that is not a life you want to go through.
Thank you so much. So we'll sum up this section of our discussion. So one thing which Dr. Taneem Saif had advised me, that it's not about the field, whether it's bad or it's good. It's about what you do with the field. So if you have passion with something, you take up that field and you can reach up to, you can find satisfaction and you can reach excellence. And if you don't have that passion and you think that, no, if I take this field, what will the society think of me, and my other colleagues are doing so and so, I will become inferior in their sight, and so I have to do this field. So instead of that, what our panelists have put forth, find your passion and you will find satisfaction automatically, and you will find that excellence is very easy in the field in which you have your passion along. So moving on, I would like to ask Dr. Usama, when we are into our PG days, and here on the path becomes very tough, and along this journey, how does one ensure that he is personally developing himself? So his personality development, including all domains, his spiritual aspect, his physical aspect, his family well-being and all. So how do PG doctors ensure their personal development along with academic development in this journey?
The first thing is, it becomes very difficult to manage all these aspects. I mean, you're definitely going to compromise on other things when you're doing PG, because it becomes very hectic and it is a very demanding job, especially first year PG. They say, if I'm not wrong, they say it's a dog life. First year PG is considered as a cheap labor. If the moment you get a PG seat, you'll be overwhelmed, you'll be on cloud 9, you'll think that I've cracked MD radiology or something in Usmania or something. So when you get into the hospital, you understand that there are monsters sitting over you. there are second year PGs, above him SRs, above him HOD. Everybody is there only to harass you. So what I'm trying to tell you is, don't go in with the mindset that you're going to be welcomed there. How much ever amount of knowledge you have, it's going to be definitely less than what they have. So they don't gauge what you were, how much you know. What they want is how much disciplined you are. I mean, don't try to play over smart there. When I was there, initially what happened is I went in, I found a senior, I've read metabolism of propofol. So I was going, sir, आपको मालूम है propofol कैसा metabolize होता? Sairam sir was there, he was looking at me. What do you think of yourself? You don't know, propofol has got a good amount of extra hepatic metabolism, and he started taking me, I mean, big class on that. So what I'm trying to tell is balancing professional as well as family life is very difficult. You have to prioritize professional life over other things. Definitely one important thing I would like to share you is what is our intention of getting into PG or practicing medicine. It boils down finally to that point. Whether you want to earn money, you want fame, you want name in your peer group that he is doing some other thing, I am doing this, I am into a good college, he is into a bad college, he is just MBBS, I am doing post-graduation, or prospects for other things like marriage increase when you join PG. I mean, these are all the intentions we have. Now, what intention we should have as Muslim doctors is, first thing, primary and only intention, this is what I'm trying to say, only intention is you want to serve humanity by giving them good health care. खिदमत खल्क के जज्बे के साथ आप जाके प्रैक्टिस करेंगे तो हर चीज़ आपकी जो है ठीक हो जाएंगी. आप नाम के वास्ते, पैसे के वास्ते या किसी और चीज़ के वास्ते जाएंगे तो डेफिनेटली आप जैसा करना चाह रहे हैं वैसा कर नहीं सकते. तो एंड द ओनली इंटेंशन, मैं पैसे भी कमाना चाह रहा हूँ और फिर खिदमत भी करना चाह रहा हूँ, दिस इज नॉट द इंटेंशन यू शुड हैव. Because it is, they have written that it is as good as selling fruits. एक मेवा फरोश जो मेवा बेचता, आप भी जो है बहैसियत एक डॉक्टर अपना फन बेच रहे हैं, बस आप डॉक्टरी बेच रहे हैं, वो मेवा फरोश मेवा बेच रहा, बस दोनों में कोई फर्क नहीं बाकी रहा. तो दिस इज द इंटेंशन विच यू शुड हैव. और फैमिली इंपॉर्टेंट ये है कि बहुत लोग सवाल करते हैं कि भाई शादी प्लान करना या नहीं करना, बच्चे प्लान करना या नहीं करना.
We'll come to marriage aspect.
पीजी
That is a
तो
separate
वो शायद वेद भाई, नूर और अफरा मैडम कवर करेंगे. लेकिन मैं बोलना ये चाह रहा हूँ कि पर्सनल लाइफ में इट बिकम्स वेरी डिफिकल्ट. बात चीज़ें जो हम कर सकते वो ये है कि पाबंदी के साथ जो है टाइम पे नमाज पढ़ लेना, ये तो हम कर सकते, ये तो फर्ज है. तो उस पर तवज्जो देके और बाकी का टाइम मैक्सिमम कोशिश करना कि प्रोफेशनल एस्पेक्ट पे ज़्यादा तवज्जो देना. ये एटलीस्ट ये 3 साल तक तो शायद आई थिंक दूसरे चीज़ों पे कोई वहदत मकसद जो बोलते हैं ना, आई मीन सिंगल गोल यू शुड हैव, दैट यू शुड डू गुड इन योर पीजी, दैट यू शुड हैव.
Okay. Just to conclude this aspect, if you divide your life into different compartments, you will have the concept of balancing everything, and you will not be able to balance everything. And if your life is a whole, and your professional time and your family time and your other aspects of your personality, if they are into one single whole, so you will find satisfaction everywhere, and you will try to see that everything is getting their full right. So if you divide your life into different compartments, you will not be able to juggle everything. So if your professional life, if you are finding that spiritual enlightenment in your practice, and you are completely immersed in that with that sense, and you carry that the same to the masjid, you will find what you want to do with your life. So that aspect of making your life into a single entity, not divided into compartments, I think that should be the goal in front of us instead of juggling different things. Moving on to Dr. Afra, as a psychologist, I would like to ask that as Dr. Sama pointed out, there is a long hierarchy which harass the youngsters, and many think that why are they so cranky, why is he acting like a psychopath, and why are they like that. So might be they face the same thing, and they are just reflecting what had happened to them. Might be, I'm not generalizing, but that's what most PGs just reiterate. So as a psychologist, what do you advise PGs to how to maintain their mental health, and how to see that what behavioral traits they are building on when they are going into PG, not affecting their mood, being so cranky after going home because the unit chief had scolded him, he's now scolding his wife and all. So how do you maintain that behavioral trait when doing PG?
See, irrespective of PG, as a human being, remember one single point, it will help you lifelong. Okay? When you are angry, someone has scolded you, something has happened to you, okay? Don't react. Same day, okay? Don't react same day. Go back to your home, let the night pass, okay? Sleep nicely. Next day morning, if you are equally angry, then it is worth reacting. Okay? Maybe in a milder form, or in a better way, you can think, complain to your professor, or you want to talk to a senior that do not behave similarly, or you just want to let it go, whatever it is. If the next day you are okay, that it means that either you were tired, you were hungry, the other person was unjust. These could be reasons, but do not react the same day. This will balance everywhere, be it your house, be it your college, be it your hospital, everywhere. Follow this rule. This is personally statue. Are you a statue? Just show some expression, at least on the face. If you don't speak, I will not react. Because the things spoken in anger, you will forget. The person in front of you will not forget. Okay? So, the golden rule is don't react immediately. Okay? That will be the best thing. One more thing for previous questions. I'm not contradicting, but adding to it, because my nature is different from what they have told. They told follow your passion. Okay? If someone doesn't have passion, there are 19 subjects you have been reading for PG, frustrated that you are not getting a seat. Now you have lost interest in all of them. So it is not a matter of worry. You just find out what you hate. Don't join that branch. Okay? Don't join that branch. Find out what you hate. Like for me, it was, I cannot go and stand in OT. I don't like OT. Okay? That's suffocating atmosphere. So no anesthesia, no surgery, no ENT, no ophthal, no OBG. What is left? Medical branches. Okay? Medical branches, I cannot go to radio and medical because I am very much particular about family. Okay? Then what? Pathology. Okay? Mother of paraclinical, daughter of clinical. Chalo, beech mein. I took it.
Thank you. One personal anecdote. You said not to react. When I was being ragged, I did not react, and he got so angry that I was not reacting. So sometimes you will have to react, maybe, but in an appropriate manner.
Still, the burden of onus will not lie on us.
Exactly. As one author said, that you don't give the permission to others to offend you. If you are feeling offended, you have given them permission to offend you. So if you follow that rule and maintain your own mental health, you will not become cranky and psychopathic.
That is the day I gave you chance for second day. Next day you can react.
I would like to ask Dr. Shadan Khadri, what are the family challenges what a PG faces, and especially as a female specialist, what do you think that female PG should hold on to while doing PG so that they can fulfill all of their responsibilities?
एक सेंटेंस में तो इसका आंसर नहीं होगा at the time. Female के challenges are not restricted only to the house. ठीक है? Even at workplace we are judged. Like अच्छा female पीछे आने वाली है ना, she will keep taking leaves. Female पीछे आने वाली है ना, हर बहाने पे she will keep taking offs now. तो ये वहीं से भी शुरू हो जाता. अब घर पे रहेगा कि अच्छा विनोदी जी ज्वाइन करे ना, पूरा टाइम इन्होंने हॉस्पिटल में रहने वाली है. So there are two things to it. So आपको घर में भी आप अपने हाथ में ये है कि जो घर वाले यहाँ बैठे हैं, so they should understand it's a PG time and it's going to be really really tough in the first year. तो अगर आप मेडिकल बैकग्राउंड से हैं तो आपको मालूम होना चाहिए अगर आपकी बेटी बहू PG ज्वाइन करे मतलब उनका पहला साल गया, उन्होंने आपका ख्याल नहीं रखने वाले हैं, इंस्टेड आपको उनका ख्याल रखना है. बोलने में आसान दिख रहा है, करने में मुश्किल है, लेकिन इम्पॉसिबल नहीं है, कर सकते हैं. दूसरी चीज क्या है कि अगर आपकी शादी PG से पहले हो गई अगर, तो आई थिंक यू कैन हैव अ डिस्कशन विद योर पार्टनर एंड टेक द सब्जेक्ट. जिस अगर उनको दिख रहा है कि ही वोंट बी एबल टू कोऑपरेट, यू नीड सम क्या बनना चाहिए, थोड़े से सैक्रिफाइसेस अगर आप कर सकते हैं, वेल एंड गुड, फॉर द सेक ऑफ योर फैमिली इट्स वेरी गुड. एंड कमिंग टू फैमिली लाइफ, हाउ टू मैनेज, नाउ आई एम ए मदर ऑफ 4 kids, no one knows here, and I'm Alhamdulillah, I've completed my super specialization में थोड़ा सा कुछ practical रुका हुआ है. तो the challenges are going to be many. अगर ये चैलेंजिंग नहीं होता, ये बहुत आसान होता, तो मैं अकेली आने बैठी होती एज यूरोलॉजिस्ट और भी बहुत बैठे होते. So it's going to be tough. ये आपको अंडरस्टैंड करना है एंड विद दैट एटीट्यूड आप अपने आप को फ्लेक्सिबल रखोगे. आप शायद थोड़े फैमिली कमिटमेंट्स नहीं कर सकते, तो पूरा टाइम अपने आप को कर्ज करने की जरूरत नहीं है. आई एम नॉट डूइंग दिस, आई एम नॉट, इट्स ओके. अपने आप को फॉरगिव कर लो कि ठीक है, दैट्स ओके, इट्स अ पार्ट ऑफ लाइफ. एक साल रहेगा, 2 साल रहेगा, उसके बाद इंशाल्लाह एवरीथिंग विल फॉल इनटू प्लेस. सो दैट इज व्हाट आई थिंक आई कैन से. एंड रिगार्डिंग द प्रीवियस क्वेश्चन आपने पूछी थी कि एकेडमिक्स और क्लिनिक्स को कैसे मैनेज करना या बैलेंस करना. एक उसमें हाँ, द वेरी फर्स्ट क्वेश्चन जिसमें आप मेरे को आंसर करने का चांस नहीं दिए थे, अपॉर्चुनिटी ना, एंड से अ फ्यू वर्ड्स अबाउट इट कि एकेडमिक्स एंड क्लिनिकल्स आर नॉट टू ऑपोजिट थिंग्स जो आपको बैलेंस करने के लिए, दे गो हैंड इन हैंड. सो आई ऑलवेज टेल लाइक whoever has read with me, prepared with me, they know I always carry a small diary. उसमें आपको लिखना है आपके राउंड्स के बाद व्हाट यू डोंट नो. सो इट्स वेरी इंपॉर्टेंट टू नो व्हाट यू डू नॉट नो. और वो एक फिजिकल फॉर्म में अगर आपके सामने है ना, इट्स वेरी गुड. जब भी आपको टाइम मिलेगा, आप राउंड्स पे जा रहे हैं, योर बॉस विल आस्क यू कि इसका क्या है, डू यू नो दिस, यू डोंट नो, दैट्स ओके. पहले 3-4 महीने आपको कुछ भी नहीं मालूम रहने वाला है. राइट डाउन व्हाट यू डोंट नो, लिखते जाओ. हर दिन अपनी डायरी में लिखते जाओ जो जो आपको नहीं आता. जब भी टाइम मिला, यू नो नाउ कि आपको करना क्या है. आप तो इजी है, फोन खोलो, जल्दी से एक रिव्यू आर्टिकल उसका स्टैंडर्ड निकाल लो, एक 4 लाइन आप पढ़ लो. अगर आपके पास उससे ज्यादा टाइम है तो लिख लो. आई ऑलवेज, पहले जब मैं पीजी में था, दैट वाज नॉट अ टेक्नोलॉजी वाला टाइम, 10 years ago, आई यूज्ड टू मेंटेन अ डायरी एंड आई यूज्ड टू राइट डाउन. अब इट्स टेक्नोलॉजी वाला जमाना. इफ यू कैन इन्वेस्ट इन अ गुड टैब, राइट एवरीथिंग इन दैट टैब. वो छोटी डायरी में क्वेश्चंस है ना, आंसर वो वाली बुक में रहना. 3 साल आप उसको थोड़ा थोड़ा करते जो 2 साल से, जब 3 years 3rd year आपका एग्जाम का टाइम होता, इट्स द टाइम ऑफ कंसोलिडेशन. आप जो जब पढ़े थे वो सब आपका कंसोलिडेट होता एंड यू विल बी रेडी फॉर योर एग्जाम.
Thank you. Just one word answers from all the panelists. When is the best time to get married, and should we marry a doctor?
I think it's a very personal question. I got married very early in my life. I was in 3rd year MBBS when I got married, so I don't think I can answer on it. As early as you can, as I think, as you think you're getting a right partner, there are right time to get married.
Thank you. Dr. Afra?
Loha gap major khatarama. Since you are getting a cash match, you are in correct age, get married. 25 years of your life, you are spending with your parents, they give you good time, they have unconditional love for you. Remaining 50 years, double of your life you are spending with your spouse. Correct spouse is very important. When you have all the mind to think, senses to feel, you are getting married to a person. So choose the correct person, not PG. You're not marrying PG. Okay? And one more thing I would like to tell girls, don't search for only doctor spouse. Not possible. Look at the opposite side. How many boys? In your class, how many boys are there? If every girl is waiting to get married to only doctor boy, her age will cross the limit. See correct qualities. See if it what Islam says. Iman,
Okay.
virtuous, and tell him the type of work you are doing. If he does not understand, then don't marry non-married. Okay, that is what I am.
Thank you. Dr. Samu?
मैडम का जो एक प्रेजेंटेशन है, आप लोग बाद में मैडम से रुजू करिए, शी विल एक्सप्लेन एवरीथिंग. बहुत अच्छा बनाया था एक्चुअली, बिकॉज ऑफ पॉजिटिव ऑफ टाइम यू कुड नॉट प्रोजेक्ट दैट. एक बार आप लोग मैडम से बाद में रुजू करिए, मैडम इंशाल्लाह अच्छा बना दे. जनरली आप लोग मेडिकल कॉलेज में जाते हैं तो व्हाट प्रोफेसर सजेस्ट इज डू नॉट मैरी, और इफ यू मैरी डू नॉट कैरी. दिस इज व्हाट दे से इन पीजी लाइफ. बट व्हाट आई एम ट्राइंग टू से इज, ये मसला जो है ऐसा कुछ फिक्स्ड रूल नहीं है कि आप शादी कब करना है कब नहीं करना है. मसला फिक्री है. अभी तलहा से हम लोग बात कर रहे थे नाश्ते पे कि इसके वास्ते जो है फर्जियत के तकाजे हैं. ऐसा नहीं है कि शादी जो है फर्ज के दर्जे में, बाज हालात में फर्ज के दर्जे में हो जाता, बाज हालात में मसनून रहती, सुन्नत के दर्जे में रहती. तो कब शादी करना है इसके वास्ते आपको एक अच्छे आलिम से रुजू करिए या फिर साहिब इल्म से रुजू करिए, उनसे मशवरा करिए. वो लोग एक्सप्लेन करते हैं कि आपके कंडीशन के हिसाब से, आपके हालात के हिसाब से, आपका जो वर्क स्टाइल है, आपको जितना पढ़ना है, जितना काम करना है, फिर फैमिली की रिस्पॉन्सिबिलिटीज फुलफिल करना है, ये सब चीजों को कौन सा भी डिसीजन लेने से पहले 3 मरहले रहे. सबसे पहले उस डिसीजन के बारे में कंप्लीट नॉलेज हासिल कर लेना. ठीक है, जितने रिसोर्सेज है पूरा यूटिलाइज करना, उसके बारे में नॉलेज हासिल करना. नंबर 2 मशवरा करना, मशवरे में खैर है, मशवरे में बरकत है. नंबर 3 इस्तिखारा करना. इस्तेखारा करने के बाद जो भी आपके दिल में ख्याल आता है, अल्लाह ताला जो भी जो आपके दिल में ख्याल डालते उस पे जो है इस्तेखामत के साथ जुड़ जाना। तो ये 3 स्टेप्स आप लेने के बाद में देन यू डिसाइड वेदर यू शुड मैरी और नॉट। लेकिन एक चीज मैं जरूर बोलना चाह रहा हूँ आप लोगों से कि शादी इज नॉट इजी। शादी के साथ साथ बहुत सारी चीजें रहती है जो बहुत सारा आपका टाइम, बहुत सारी आपकी एनर्जी, बहुत सारे आपके इमोशंस को जो है ड्रॉप करता है। तो बहुत इंपॉर्टेंट डिसीजन है लाइफ का। आप लोग स्टेटस भाई एमडी जनरल मेडिसिन है उनसे शादी करना है मेरे को, नॉन मेडिको है इनसे शादी नहीं करना है, ऐसा नहीं है। एवरीथिंग इज नॉट व्हाइट एंड ब्लैक। आप लोग यकीन नहीं करते कितने सारी बच्चे एमबीबीएस है, पोस्ट एमबीबीएस है, दे आर जस्ट वेटिंग फॉर राइट मैचेस। मिल रहे हैं बच्चे, मिल रहे हैं बच्चे, फाइनली इट्स गेटिंग वेरी लेट। जो अच्छे अच्छे मैचेस आ रहे थे वो भी नहीं आ रहे। मैं प्रैक्टिकली जो हो रहा है वो बता रहा हूँ। कोई खैर नहीं है कि भाई आप पीजी में शादी नहीं करना है। थोड़े बच्चे बहुत ओवर एम्बिशियस रहते हैं, दे वांट टू गेट मैरिड ओनली आफ्टर कंप्लीटिंग द सुपर स्पेशलिटी। थोड़े बच्चे बोल रहे हैं अरे अभी क्या है, मेरी उम्र है कितनी भाई 28 साल है, 35 की उम्र में कर लेता हूँ मैं, तो इट बिकम वेरी लेट। तो आप लोग ये ऐसा सिंगल पॉइंट आंसर नहीं है इसका कि भाई आप कर लो जब कर लो बोल दे। तो इस मशवरा करके करिए जो भी करो।
डॉक्टर सादिक आजम,
When to get married? When you find the right person. That's it. Find the right person for the right reasons, get married. Otherwise, don't.
Thank you so much. When we talk about marriage, when you are thinking about it earlier, you will have a long list. Okay, that spouse should have this quality and this quality and this quality. And when you delay it long, and at the end, the boy will say, अगर बच्ची मिल गई तो बस है, अगर लड़का मिल गया तो बस है. तो उतना डिले करने से भी, I think we should avoid ourselves. फिजियोलॉजिकल एक एस्पेक्ट होता है कि एजिंग कैसी होती है और कौन सी एज राइट है। तो जो व्हाट द प्रॉफिट सल्लल्लाहु अलैहि वसल्लम सेड, अय्युह शबाब, वो यूथ मन इस्तता, जिसके पास इस्तात है, whoever has the capacity and capability, he should get married. So what is that capacity? Dr. Osama was pointing out your mental capacity, your physical capacity, and your professional capacity. Professional capacity in terms, how will you be able to give right time and all. So these were some points which the panelists have pointed out. So this is a very debatable topic on how to find the right partner and their plans to hold such sessions so that we can guide young doctors in their future goals. So there were some topics regarding financial planning and future goals and all. Because of lack of time, we are not delving into that right now. But rest assured, Doctors Association for Relief and Education is there and has been working in doctors and aspires to guide young doctors so that their journey in this path becomes very much fruitful for themselves as well as for the society. And I thank all the panelists for giving their valuable opinions and advice to the young PGs, sharing their own personal anecdotes and experiences so that the young doctors have the advantage of taking those advice and moving on with this journey with excellence, satisfaction, and contribute immensely to the society. So with this, we'll conclude this panel. Again, I thank all the panelists for their time and for their answers on the panel, and I hope that you can all approach them later on for further advice. Thank you all.
Thank you all. Osama? I request panelists to please come on stage again. Dr. Afra ma'am, and please come. There is a small token of appreciation from our dear. I request Dr. Khabir sir to present a moment of token of appreciation to Dr. Hamad Hafiz Osama. Dr. Atiqur Rahman to present a moment of appreciation to Muhammad Sadiq Azam sir. I request Dr. Aisha Noman to present a memento to Dr. Shadan Khatri. Take. I request Dr. Afra to please receive a memento from Dr. Aisha Noman. Thank you, Doctor. Moving on to the next session, we have an introduction of DARE by Dr. Mohammad Akbar Hussain.
अस्सलाम वालेकुम वरहमतुल्लाहि वबरकातुहू। सबसे पहले मैं अल्लाह का शुक्र अदा करता हूँ और फिर उसके साथ साथ दुरूद हुज़ूर अकरम सल्लल्लाहु अलैहि वसल्लम पर मैं आपके सामने जो डेयर का इंट्रोडक्शन रखने जा रहा हूँ। मैं चाहता हूँ कि डेयर बहैसियत एक ऑर्गेनाइजेशन है। अगर ऑडियंस में से अगर कोई अगर बताते हैं स्पेशली न्यू कमर्स या फिर स्टूडेंट्स आपने क्या सुना है, तो शायद ये डेयर के लिए भी एक हमारे लिए भी एक एनकरेजमेंट रहेगा। तो मैं चाहता हूँ कि आपकी तरफ से कुछ आंसर आए इसका। कोई आंसर दे सकते हैं? डेयर क्या है? क्या आपने कभी डेयर के बारे में कुछ सुना है? कुछ आंसर्स आप लोग की तरफ से। मैं आपको माइक भी दे सकता हूं अगर कोई आंसर अगर करना चाहते हैं तो। आप लोग का टाइम इंपॉर्टेंट है, मैं टाइम ज़्यादा, मेरे पास इंट्रोडक्शन के लिए बहुत कम वक्त है।
Assalamu alaikum. I'm Dr. Miraluddin, currently an intern from Usmania. So DARE is an association for by doctors, for doctors. Like in the name itself, it portrays its objectives of serving society and uplifting and guiding the young medicos and doctors in the field of education and overall for the upliftment of society and betterment of humanity.
जज़ाकल्लाह। ये आंसर सुनने के बाद में इस बात की खुशी है कि डेयर कुछ काम कर रहा है और उसका रिफ्लेक्शन है ये। मैं आपको एक बात बताता चलूँ, ये जो ऑर्गेनाइजेशन है डेयर, ये एक लाइक माइंडेड पीपल, आम तौर पे ये होता है कि हम कॉलेज में, आप स्टूडेंट्स हैं, कॉलेज में हम रहते हैं तो कुछ स्टूडेंट्स आपस में मिलते हैं, दोस्ती होती है, उन लोगों की दोस्ती होती है जिनका जो एक लाइक माइंडेड होते हैं, उनकी दोस्ती होती है आपस में। इसी तरीके से जब ये डेयर ऑर्गेनाइजेशन फॉर्म हुई तो कुछ लाइक माइंडेड पीपल एक जगह पर जमा हुए और वहाँ पे उन लोगों ने ये डिसाइड किया कि हम एक ऑर्गेनाइजेशन कायम करेंगे। अब वो ऑर्गेनाइजेशन कायम होगी तो काम क्या करेगी, वो उसका मकसद क्या होगा? उसका मकसद to achieve divine pleasure of Almighty Allah, to succeed both the life here and hereafter. अब ये जब इसका मकसद है तो ये कहाँ से आया, ये किस बुनियाद पे आया, इसकी वो कौन सी बुनियाद थी, ये कौन सी बात थी जहाँ से ये मकसद को ड्राइव किए? तो लाजमी बात है कि हम एज ए मुस्लिम इसका जो ड्राइविंग फोर्स होगा, वो जो डिवाइन गाइडेंस जो होगी, वो कुरान और सुन्नत होगी। और इसी की बुनियाद पे डेयर ने अपना एक मिशन बनाया है। वो मिशन क्या है? DARE is committed to provide a forum for Muslim physicians and allied healthcare professionals to promote real awareness of Islamic medical ethics and values with a responsibility towards humanity at large. मैं अल्लाह ताला का शुक्र अदा करता हूं कि जो पैनल हुआ, हमारा जो पहला जो पैनल डिस्कशन हुआ, उसमें तकरीबन ये सारी चीज़ें हमने कवर की, हमारे पैनलिस्ट ने बहुत अच्छी से तरीके से कवर की। और ये जो ड्राइविंग फोर्स था, ये जो एम और उसका जो मिशन था, वो अगर हम देखते हैं, वो उसको जो ड्राइव किया गया है वो इस आयत की बुनियाद पर है, कुंतुम खैरा उम्मतिन उखरिजत लिन्नास तामुरूना बिल मारूफ व तनहौना अनिल मुनकर व तुमिनूना बिल्लाह। अब दुनिया में वो बेहतरीन ग्रोह तुम हो जिसे इंसानों की हिदायत के लिए, हिदायत व इस्लाह के लिए मैदान में लाया गया है। तुम नेकी का हुक्म देते हो, बदी से रोकते हो और अल्लाह पर ईमान रखते हो। ये आयत वो जो ड्राइविंग फोर्स थी, जो ये प्लेटफॉर्म बना है। आज ये कोई अगर आप डेर का अगर कोई आप प्लेटफॉर्म का अगर नाम कहीं पे भी सुनते हैं तो ये एक प्लेटफॉर्म है। यहाँ पे every doctor is invited to join this and work along with the DARE and its associates. अब हम देखते हैं कि इसके डिफरेंट, अगर हम देखेंगे कि डेयर जो वर्क करती है वो डिफरेंट एंगल्स पे काम करती है। अगर हम देखते हैं तो एक पहलू ऐसा रहता है जहाँ पे आप किसी एक स्पेशलिटी पे फोकस करते हैं, बट क्योंकि ये जिंदगी से जुड़ा हुआ है और जब कोई चीज़ जिंदगी से जब जुड़ी हुई रहती है तो वहाँ पे आपको डिफरेंट एस्पेक्ट्स पे काम करना पड़ता है। तो उसमें देखेंगे मोरल वैल्यूज पे कुछ काम होता है, नॉलेज एंड स्किल्स पे भी काम होता है, रिलीफ पे भी काम होता है, हेल्थ अवेयरनेस पे भी काम होता है। इसके कुछ ग्लिम्सेस हैं, मैं आपके सामने रखने की कोशिश करूँगा। अगर हम देखें रिसेंट, और मैं क्योंकि 10 साल से डेयर अपना काम अंजाम दे रही है, 10 साल की अगर मैं एक्टिविटीज़ बताता चलो तो शायद बहुत ज़्यादा टाइम हो जाएगा। अगर मैं रिसेंट अगर एक्टिविटीज़ की बात करूं, मोरल वैल्यूज़ में हमने एक मेडिकल फिक्स कॉन्फ्रेंस की थी। मैं समझता हूं कि शायद आपके पास बहुत सारे लोगों ने इस कॉन्फ्रेंस को अटेंड भी किया होगा, जहां पे हमने कोशिश की कि एज ए डॉक्टर आप अगर अपना माल कमाते हैं तो वो किस तरीके से कमाएंगे, चाहे वो हलाल है तो किस तरीके से हलाल होगा, हराम है तो किस तरीके से हराम होगा, कौन सी चीज़ें हमारी फील्ड में जायज़ है, कौन सी चीज़ें जायज़ नहीं है, और ऐसे मसले मसाइल जिसमें हमको मुश्किल होती है एज ए मुस्लिम हमारी अपनी प्रैक्टिस में। तो हमने कोशिश की कि ये जो तमाम अपने जो मुश्किल मसले होते हैं, सवालात होते हैं, उनको हल करने की हमने कोशिश की इस फिक्स कॉन्फ्रेंस के जरिए। इसके अलावा एवरी सेकेंड संडे, हर महीने के दूसरे हफ्ते हमारी एक एक्टिविटी होती है जो कि कुरानिक सेशन होता है, जो फजर के बाद होता है, जिसमें हम तमाम डॉक्टर्स एक जगह जमा होते हैं और फिर कुरान के चंद आयत पे हम डिस्कस करते हैं और फिर अल्हम्दुलिल्लाह वो उस डिस्कशन की बुनियाद पे हम कोशिश करते हैं कि अपनी ज़िंदगी उसी पे हम ले चलें। ये एक मोरल वैल्यूज की एग्जाम्पल थी। ये भी एक कुरानिक सेशन है जिसमें हम कुरानिक सेशन की तस्वीर है जहाँ पे हम जमा होते हैं और फिर अपने प्रोग्राम्स करते हैं। नॉलेज एंड स्किल, जब नॉलेज और स्किल की बात आती है तो रेगुलर हमारे CMEs होते हैं। आमतौर पे अगर हम देखें कि हम जिस तरीके के CMEs जो मार्केट में जो चलते हैं वो या तो किसी का प्रमोशन होता है या फिर आपका कोई ब्रांड होता है जिसकी ब्रांडिंग के लिए लोग अपने CMEs को प्रमोट करते हैं। लेकिन अगर आप यहाँ पे देखेंगे तो हर महीने के 4th संडे हम एक अपना प्रोग्राम करते हैं, CME करते हैं। उसकी खास वजह ये होती है कि हम एक दूसरे से कनेक्ट रहें, जुड़े रहें, दूसरा उसके साथ साथ एक इस्लामिक टॉपिक हो जो हमको हमारी ज़िंदगी की राह पे चलने के लिए, हमारे रास्तों को आसान करने के लिए एक हम इस्लामिक टॉपिक रखते हैं। और सेकंड जो टॉपिक होता है वो हमारे नॉलेज और स्किल्स को बढ़ाने के लिए। अब जहाँ तक की बात है, मैं ओवरऑल डेवलपमेंट की अगर मैं बात करता हूँ तो ये हमारे लिए ज़रूरी है कि दुनिया और आखिरत दोनों की कामयाबी हो। ये दुनिया और आखिरत दोनों की कामयाबी के लिए हमको जो चीज़ें चाहिए वो रेगुलरली हम एक दूसरे से टच में रहें। जैसे कि अभी हम सूरह असर की तिलावत में सुन रहे थे कि जब कंपेनियंस हुज़ूर अकरम सल्लल्लाहु अलैहि वसल्लम के सहाबा कंपेनियन आपस में मिलते हैं तो वो एक दूसरे को हक़ और नसीहत की तलकीन करते, एक दूसरे को हक़ की बात बताते, एक दूसरे को सपोर्ट करते। तो ये इसी तरीके से ये ऐसे डॉक्टर्स जो इस ऑर्गेनाइजेशन से अटैच हैं और हमारे पास आकर जुड़ रहे हैं, उनकी तरबियत हो और उसके साथ साथ उनकी नॉलेज और स्किल बढ़े। ये काम हर महीने के चौथे इतवार को एक CME के जरिए से किया जाता है। और एक मैं खास बात बताता चलूं, जिस तरीके से पैनल से भी बता रहे थे कि कोई भी चीज़ बाकी रहने के लिए जब तक कि आप लोगों को फ़ायदा पहुंचाते रहेंगे वो उस वक्त तक अल्लाह ताला भी उसको बाकी रखता है। ऐसी चीज़ कुरान की आयत का भी मफहूम है कि आप अगर लोगों की इंसानियत के अगर फ़ायदे के लिए काम करेंगे तो वो उसमें इंसानियत की भलाई होगी और उसमें आपकी भी बहार रहेगी। तो ये जो कंसिस्टेंसी, पैशन, कंसिस्टेंसी, ऑनेस्टी, ये जो हम अल्फाज जो सुन रहे थे, अल्हम्दुलिल्लाह ये चीज़ें आपको इस प्लेटफॉर्म पे मिलेगी। इस प्रोग्राम में की खास बात ये होती है कि यहीं पे इसको लिमिट नहीं किया जाता है कि एक सिर्फ आपके सीएमई और आपकी नॉलेज की हद तक ही हो गए, बल्कि कॉम्पिटिटिव एग्जाम्स अभी जिस तरीके से हम आज का जो सेशन चल रहा है कि स्टूडेंट्स को सपोर्ट करना है, अभी ये खुद भी एक उसका एक सेशन, एक पार्ट है जहाँ पे पीजी स्टूडेंट्स की गाइडेंस एट द टाइम ऑफ एडमिशन, फिर पोस्ट एडमिशन जब इनको एडमिशन हो जाता है उसके बाद में फिर फेलिसिटेशन, इस तरीके से एक बेसिक एक्टिविटीज जो स्टूडेंट के लिए जो ज़रूरी है, ये तमाम की तमाम चीज़ें, तमाम की तमाम एक्टिविटीज़ डे के प्लेटफॉर्म से होती है। उसके बाद कम्युनिटी सर्विसेज, हम अगर कम्युनिटी सर्विसेज पे जाएंगे तो हम देखेंगे कि अगर मान लीजिए कहीं पे भी नेचुरल कैलामिटीज आ जाती हैं तो डेर वहाँ पे भी अवेलेबल रहता है। नेचुरल कैलामिटीज, फ्लड्स के टाइम पे मेडिकल कैंप्स करना है, अपार्ट फ्रॉम मेडिकल एट द टाइम ऑफ नेचुरल कैलामिटीज, इफ वी रिसीव एनी रिक्वेस्ट फ्रॉम एनी साइड वी डू आवर मेडिकल कैंप्स, और उसके लिए हमने मुख्तस करके रखा है कि एक थर्ड संडे हमारी एक्टिविटी का हमने फिक्स करके रखा है जहां पे हम एवरी थर्ड संडे एक मेडिकल कैंप करते हैं। कम्युनिटी सर्विसेज में एक और अगर हम देखें तो डेयर सेकंड ओपिनियन क्लिनिक, ये आपको मिलेगा। इसका एक डेयर सेकंड ओपिनियन क्लिनिक एंड स्टूडेंट्स के लिए लाइब्रेरी का इनॉग्रेशन, ये तस्वीर में आप देख सकते हैं। इसमें डेयर सेकंड ओपिनियन क्लिनिक जो अजीजिया मस्जिद में चल रहा है, जहां पे ऐसे पेशेंट्स जो सफ़र होते हैं, जिनको अगर सर्जिकल ओपिनियन चाहिए या फिर किसी को सेकंड ओपिनियन चाहिए, जहां पे वो लोग समझते हैं कि उनका यहाँ पे ट्रीटमेंट सही तरीके से नहीं हो पा रहा है या किसी भी रीजन की वजह से, तो यहाँ पे स्पेशलिस्ट मौजूद रहते हैं। वहाँ पे पेशेंट्स मस्जिद अजीजिया के सेंटर पे जाते हैं और वहाँ से डॉक्टर से ओपिनियन लेते हैं और फिर अपना ट्रीटमेंट करवाते हैं। इसके अलावा स्टूडेंट्स के लिए हमारे डिफरेंट हमारे लाइब्रेरीज हैं जो मेल्स के लिए सेपरेट हैं और फीमेल के लिए सेपरेट हैं। ये बेसिकली ये चंद बातें थी जो डेयर के इंट्रोडक्शन के तौर पे मैंने रखा है। आप तमाम से मैं गुजारिश करता हूं कि हमारी जो लिंक ट्री जो काफ़ी समय से इस पर डिस्प्ले हो रही थी, उस पर आप उसको स्कैन कीजिए, उस पर आपको तमाम हमारा इंट्रोडक्शन मिलेगा और गूगल फॉर्म का मेंबरशिप का लिंक मिलेगा। उसके साथ साथ यूट्यूब चैनल मिलेगा जिसको आप सब्सक्राइब कीजिए, व्हाट्सएप चैनल मिलेगा उसको सब्सक्राइब कीजिए ताकि हमारी एक्टिविटीज आपको मिलते रहें। इसके अलावा लास्ट बात और अहम बात यह है कि ये जो तमाम चीज़ें हम जो करते हैं वो सिर्फ और सिर्फ अल्लाह को रज़ा करने के लिए करते हैं, अल्लाह को राज़ी करने के लिए करते हैं। तो फिर एक बार मैं लास्ट में आप तमाम से रिक्वेस्ट करता हूं कि डेयर के एक्टिविटीज़ में, डेयर में पार्टिसिपेट कीजिए और डेयर ज्वाइन कीजिए। इंशाल्लाह हम इस कारवान को लेकर आगे बढ़ेंगे। अस्सलाम वालेकुम, जज़ाकल्लाह खैर।
Jazakallah, Dr. Akbar Hussain sir. Moving on to the next session, we have Central PG Counseling Process by Dr. Muhammad Ubaidullah, DNB Pediatrics.
Assalamu alaikum wa rahmatullahi wa barakatuh. First of all, I would like to thank the organizers for giving me this opportunity. So, most of you and every one of you might be thinking why I kept this slide. Actually, all of you at this stage, till now, you were in an eggshell, like preparing for the medicine, preparing for the exams, doing internship, and busy in your academics, and preparing for the NEET PG. Now, after getting the rank, you have broken a part of it. Now peeping outside. What is there for me? Whether I should get which branch, whether I should get clinical branch, or in clinical, medical or surgical, or paraclinical, or what, preclinical, or DNB or diploma. So, in my presentation, I would like to try to answer all these queries and all these things, how to choose the branch, how to go about it. So, everyone, like in the before this panel discussion, I was saying about this. Next. Back. No, next. वहीं से क्लिक करो बैक करके ठीक है Actually, I don't know why it's not coming, but I put this keynote. Okay, and many of the panelists also said during the presentation, okay, why we are doing PG. Doing PG is not a compulsion, but a passion. This is the keynote. This is the basic thing. We didn't discuss before putting this keynote or this organization what to say, but you can think how our minds work. All the PGs thinks in same way, and they have same mind how to go about the branch, how to choose their branch like this. Next. So before starting any counseling and before starting any counseling pressure, what you have to do is first. You should make the list of branches which you want to opt. So the first thing is branch selection. You have to first select your branch. So how to go about it? There is a procedure for that. I think even the MCC has given in the PDF like what you have to do. For that, you have to first go through the previous year allotment list thoroughly, and at the end of the list you will get a rough idea which branch you will get through All India, State, DNB and deemed institutes. So first and foremost thing is you have to select your branch. Then make a list of subjects which you want to opt in decreasing order. What is your first priority? Then second priority, then third priority, like that. You might be thinking why I kept this slide. See, you can't say that my father wore that dress, that's why I want to wear, like this child. And like this cat, what it thought, back. So what it thought, okay, because mouse went inside, I will also go inside. Not like that. So you have to think about your passion, about your interest, then decide about your branch. So it means one size doesn't fit all. Next. वैसे करो. बैक करके फिर आओ. Okay. So after this, now make a preference list for AIQ, state, DNB, DEEM, with respect to location. So next thing is location. First branch, then location. Whether you want to stay in city, whether you want to go to other state, whether you want to go to other district, like that. Next. Next. So first, you have to make a list of what you want. Then you have to think, see, one more thing you need to decide is, you need to notice, like all the branches in one college will not be same. In one college, one branch will be like good, another will be not that good. So you need to inquire about it. You go to that college and then inquire about it. Next. So this is the thing. Before counseling, ask the PGs of respective college and branch. Next. So take a branch depending upon your interest and nothing else. What all they were saying in the previous panel. Next. Take a branch in which you have passion, give preference to masters, not diploma. Next. That is MD or MS greater than DNB, then diploma. Next. Take opinion suggestions from your near and dear ones who have some basic idea about it, what this is all about, not from everyone. Whether whether it is the person who did the PG in that department, in that field, or who is doing the PG, or who wants to take, and your family members or your spouse, father, mother, or elder brother or sister, like that. And in case of confusion, do istikhara. If you take seats outside your state, any favoritism, racial difference, or religious difference. Next. The answer is a big no, because 50% are from other states. Whichever department you go, whichever college you go, the 50% will be from other states, especially government colleges. Next. So should you opt for seat outside Telangana? Yes, because we are giving 50% seats to all India. Why shouldn't you opt outside the states? So if you can, it's better to opt in other states also. Next. So advantages of DNB, those who want to take DNB. In DNB there is no SR-ship, tool service required, and training, you should choose the good hospitals, mainly government hospital. Latest treatment of the disease you will get here. In all corporate hospitals, the latest disease will come there first. Then it goes to depending on the affordability, accessibility, it goes to the government colleges. So you will get a stipend on time, and it is cheaper and better than most of the private colleges. And also 6-year DNB courses are also there. If you want, you can take. If you have passion, then you can take, for example, neurosurgery or cardiology, or any surgical branch, or any medical super specialty you can take. Next. Yes. If you want to opt for the DNB, keep the following points in mind. Prefer government or semi-government government institutes. If private, seats attached to super specialty hospitals or standalone specialties. Prefer hospitals with more seats. And prefer ones which have been around for some time rather than new institutes. So these are the things you need to keep while taking admission in DNB. And also contact alumni. Okay, you have to go there, ask the PGs, discuss with the PGs, and then take the seats. So now with this, I would like to start the proper counseling process, how to go about it. Next. Yeah, here you have to concentrate. Okay, this flow chart is very important. So I think every one of you have made the registration, paid the fees, and then waiting for the choice filling. So after first round, if you get the seat, then you have to report to Lottery Institute, complete admission formalities. If you don't want, then take the free exit. Free exit means you need to just sit at home, do nothing. That is called free exit. And if you don't get the seat, then you can go to the fresh round without registration. If somebody has registered in the first, to do second time registration for the second round. Then if you want upgradation, then you have to give willingness. You just can't go and take the admission and come back. No. Admission, then give yes for to upgrade. If you are satisfied with the seat, then okay, no need to do anything. Then second round. In second round, those who have not registered for the first round can register for the second round. So second round seat allotment and the round 2 seat allotted. If upgraded, then candidate must leave from round 1 college and join round 2 college. What you have to do, if you are upgraded in the round 2, you have to first go to the round 1 college. Take the relieving order from there. Take the certificates from there. Then go to the second college and get the admission there. Then second round seat allotment. If you don't get, then wait for the third round. If you get the seat, then take the admission, as I said, and the report to lottery institute and complete the formalities. Here also, you have to give willingness to upgrade to round 3. And if you don't want this seat, you can get for example, you got one seat in Osmania. You got upgraded there and second round you got in NIMS. So what you have to do, go to the first college, take the certificates, go to the second college hospital, that is NIMS, and they take admission there. And then there you have to decide what you want to do. If you are happy with the seat, then okay. If you are not happy, you want upgradation, then again give for willingness. And one more important thing after round 2 is you have to freshly register. If you want to upgrade, you have to get the forfeiture. Your 26,000 will be forfeited. Again for the third round, you have to pay again 26,000 and then go for upgradation. Directly you can't go. So for upgradation, in round 3, you need to pay again. Your previous 26,000 will be forfeited. This is the change. Next. So now round 3. Now here also fresh registration. Who didn't register for round 1 and round 2 can register directly to round 3. And also who want upgradation, they also should register. And a third thing is the persons who want, the candidates who want to upgrade, they also have to again register with the new 26,000. Here also same thing, report to Lottery Institute, complete admission formalities. If upgraded, then candidate must leave from round 2 seat and join round 3 seat, join allotted seat, then once joined cannot upgrade or resign. This is the final thing. If after joining, see, allotment is a separate thing, joining is a separate thing. If you get allotted, if you don't join, then you can appear for the state counselling. But if you join in round 3, you can't go to the state counselling from there. Here also, exited forfeiture. For example, you got the seat and you don't join, then you will be eliminated from the further rounds. You are not eligible for the stray round. Stray round also same thing. You have to again register and again pay the fee. And then, for example, you don't get any seat in round 1, round 2, round 3. Then you can't pay, you need not pay fee for the 4th round, stray vacancy round. So it will be naturally, without any payment, without any registration, you can fill the choices for stray round if you don't get any seat in round 1, round 2, round 3. So after stray round, if you join, then it's okay. If you don't join, it is very important. You will be debarred for next 2 years from NEET and MCC counselling. Make this point, it is very important. If you don't join after getting seat in stray vacancy round, you can't write the NEET PG of 2025. And you can write NEET PG 26, but you can't participate in All India counselling. You have to go through only state counselling. This is very important. Next. So this is the same thing. Upgradation will be up to 3rd round. If a candidate joins in 3rd round, they shall not be permitted to resign from 3rd round of All India. They will not be allowed to participate in any further rounds of counselling after joining in 3rd round. This is the final round. If you join, you won't be able to participate in any other round. Next. Okay. There are two things. I'll explain this with you an example. Say, in general medicine, there are 3 seats in Osmania. A candidate in round 1, a candidate got 1 seat. Candidate A got 1 seat. So he took admission and he is happy with the seat. So he won't go for upgradation. Okay, candidate 2 got the seat and he joined, but he wanted to upgrade. That seat will come in virtual vacancy. Candidate B seat will come to the virtual vacancy. There will be two separate columns for round 2. Clear-cut vacancy and virtual vacancy. So virtual vacancy means this candidate got the seat, but he wants to upgrade his seat. If he is upgraded, if he got another seat of his choice, then this seat will be vacant. Otherwise, this seat will be occupied. And seat 3, candidate C got the seat, but he exited. That is clear-cut vacancy. So in round 2, one seat will not, out of the 3 seats of General Medicine Osmania, one seat will not come because the candidate has already occupied and he is happy with it. And second seat will come in virtual vacancy. Okay. If that candidate gets upgraded, then only you will get the seat. And third seat is clear-cut vacancy. So it is there for all, anybody can compete for it. Next. This is also very important. Each round of counseling is a separate round and the rules of each round are different. Once any round commences, the rules of that round will apply to all the candidates even if they were allotted or admitted in the previous rounds of counseling. For example, you got a seat in round 1 of All India counseling and you are not upgraded and you came to the second round. After coming to the second round, you can't say that my seat belongs to round 1, so I can exit without forfeiture. I can avail free exit. No, you will be considered as round 2 candidate only. The rules applicable for round 2 will be applicable for you also. This is the meaning of this point. So this is the start of round 1. So this all, I think I said, only the important things I underlined here. Mandatory uploading of essential documents on MCC website for seat allotted candidate. After getting the seat, first you have to upload your certificates to the MCC site. Then you have to go for the admission. Directly you can't go. You have to upload your certificates on the MCC site and then go to the physical counseling for the college. Physical reporting at the allotted medical college with original documents against round 1. Candidates who have been allotted a seat in round 1 can opt for free exit and can directly participate in round 2. Candidates who are allotted a seat in round 1 can opt for willingness to upgrade from round 1 to round 2 only after physical reporting at college or institute. You will be upgraded only if you go and take the physical admission and say yes to upgrade and say yes for willingness to upgrade. If a registered candidate is not allotted a seat in round 1, he can participate in round 2 directly without fresh registration. If you don't get any seat, you can directly participate in second round. And if a candidate wants to upgrade, then he has to give willingness for upgradation of the college. And one more thing, after every round, see here, MCC of DDHS will share the data of joint candidate in round 1, round 2, round 3 of counseling with all the participating states. So, similarly, the participating state will also share the data of joint candidates. This is very important. There will be communication between the MCC and the state universities. So they will be sharing the data of joint candidates. Next. That is the end of round 1. This is round 2. Candidates who registered for round 2 and did not get any seat allotted are not required to register again. This I said. Candidates who have resigned, not reported in round 1 need not register again. This also I said. Fresh choice selling and locking for choices for round 2. This is also very important. Before every round, you need to fill fresh choices. You can't say, I filled the choices in round 1, so I won't fill the second round. You will be out of the counseling. That's why you have to fill the choices for every round, round 1, round 2, and round 3. Next. If a candidate is freshly registered, he or she can participate in round 3 directly without fresh registration. This also I told. If upgraded in round 2, the candidate must take relieving from round 1 seat and join round 2 seat. This also I told. So, exit with forfeiture, fresh allotted seat but want to leave. Upgraded but not join from round one. They also can be exited with forfeiture of security deposit. Who joined the college institute and then resigned. These three candidates are allowed for exit with forfeiture. Candidates who have allotted a seat in round 2 can opt for willingness to upgrade from round 2 to round 3, for which they will have to physically report at the round 2 allotted college institute, then opt for willingness and have to forfeiture. This is also very important. See, whenever after round 2, if you want to opt for upgradation, then you have to forfeiture security deposit. Also do fresh registration with fresh payment of fees. Again, you have to pay. If you're not happy with the round 2 seat, you can upgrade, but for that, you have to forfeit your previous 26,000 and again pay 26,000 for the third round for upgradation. Here, from the audience, I would like to ask one question. Mic is there, no? See, there are two scenarios here. One scenario is, you got the seat in second round and you forfeited it, and you are going for the third round with fresh registration of fees. Okay, this is the scenario 1. Scenario 1 is, you got the seat, you want to forfeit with fresh deposition of with fresh registration with deposition of fees, with payment of fees. This is the scenario 1. Second round is second scenario is, you want to keep that seat and you want for upgradation, but for all this also you have to register and pay the fee. So I would like to ask from the candidate, from any candidate, which scenario he wants, whether he want to forfeit the fee and refuse the admission and go to the third round, or scenario 2, whether he wants to keep the seat and go to the third round with fresh payment of fees. Remember, in both the cases, you have to freshly register and freshly pay the fee. So tell me, why you want to opt for that scenario 1 and why? If you want to opt scenario 2 and if you want to opt that, why you want to opt scenario 2? Let me know. Did you understand the question? Okay, then tell me the answer. Anything, whatever comes in your mind, you tell. Then I will tell what is the point hidden in that. Anybody?
Scenario 2, sir.
Okay, why?
Because the seat is with us. Yes, the seat will not be
Yes.
lost.
Yes. If you have both the scenarios, go with the scenario 2, because that seat will be stick with you. If you don't get upgraded, then at least you will get that seat. Okay. If you, for example, you have a rank of 5,000, 4,999 came in the third round and applied, or old candidate only, he might be registered in round 1 only, but he put the option now, then he will get the seat, not you. So in both the cases, you have to pay. So keep the seat in your hand and then go for upgradation. This is the advice. Okay. Then round 3. Here also fresh new registration. Then anyone like who have not registered in round 1 or round 2 can register here. Those who registered but were not allotted a seat in round 1 and round 2 can register again. Here also fresh choices. If any candidate does not join round 3 seat, he may exit with forfeiture of security deposit and elimination. So he will not be eligible for the stay round. If a candidate freshly registered in round 3 and is not allotted any seat, he or she is eligible to participate in stray round. Next, this is the end of round 3. Then round 4, final stray vacancy round. So here also fresh registration, fresh choice filling. Eligible candidates who are not holding a seat or got no seats in round 1, 2 and 3 can participate in stray round. This already I told. If a candidate is allotted a seat in stray round, he or she has to report and join the allotted seat or college. He shall be debarred from NEET PG examination for subsequent 1 year along with forfeiture of security deposit. See, in the previous slide you saw, it is written 2 years. Here, 1 year. What is the meaning? Again, question for the audience.
This is for exam purpose.
See, 1 year is for the exam. 1 year is for the NEET PG exam. 2 years for the MCC counseling. It is like this. 1 year you will be debarred from the, for example, if you don't join this straight vacancy seat, you will be debarred from NEET PG 2025. And means you were debarred from NEET PG means you can't attend any counseling. But for second year, you can write NEET PG 2026, but you will be debarred from MCC counseling. You have to get the seat from the state counseling only. This is the difference. Next. Yeah, this is also very important. So before every result, you will get the provisional result. For example, round 1 results come will be coming on say 15th October. So they will issue one provisional result on 14th October. If anyone has any objection, then they can approach. If that objection is genuine, then it will be rectified. Then again they will get the correct seat, correct list on 15th October, like this. Few questions. The circumstances where the refundable deposit will be forfeited. This also I told, was when allotted a seat in round 2 or subsequent rounds. Then the forfeiture will be, deposit will be forfeited. If the admission gets cancelled after allotment due to any reason. For example, you could not produce any certificate. If your admission get cancelled, because of that also, your deposit will be forfeited. Next. Don't wait till the last minute to lock your choices and to take a printout. Please go through your submitted choices before locking, as once you lock the choices, the same cannot be changed or even modified if you have made a mistake. So be sure, before locking, check 2 times, 3 times, 4 times, 5 times. Because even MCC can't unlock your choices. That's why be sure and check many times and then go for locking. Next. If a candidate does not report at the allotted institute in round 1, this will be considered free exit. I told you, you have to just keep quiet at home, then you will be free exited. This also I told. Please note that in case you are satisfied with the seat allotted in round 1 and do not give willingness for accommodation in round 2 as yes, you will not be considered eligible for participating in round 2. That is for accommodation of your choice. So you have to giving willingness as yes is very compulsory. If you don't give that willingness, then you will not be upgraded. Next. This also I told, so no need to repeat this. Next. Okay. If my choice is upgraded, the seat allotted during the first round will be automatically cancelled immediately and allotted to somebody else eligible as per merit. For example, you got one seat in Gandhi General Medicine in round 1. In round 2, you got Osmania General Medicine. You can ask, I want to keep my previous seat. No, it's not possible. That seat will be allotted to some other person, some other ranker, and there will be no seat except for the Osmania seat for you. So be clear before putting the choices. Seat can also be upgraded in the same college by change of category, or in such a case, the candidate has to take fresh admission on the upgraded seat. For example, you got some reservation seat in round 1, but your category changed in round 2. For example, you got reserved seat in round 1 and your category changed in round 2. Then again you have to go to the same college, Usmania only. You got first seat in round 1, you got the seat as a reserved seat. But in round 2, you got that seat in open, same general medicine, you got that seat in open. So again you have to go, take the new admission and then your admission will be confirmed. If you don't go, then your admission will not be confirmed and you will be without seat. That's why it is very important. If change of category also, you have to again go and take re-admission. This also I told. Registering for the first time, registered but not been allotted in state seat in round 1 and 2, exited forfeiture in round 2 can participate. Who will not be eligible for third round of counseling, joined seat in round 1 or round 2 and state quota seat as per the data. If anybody joined in state quota for round 2, they will not be eligible for the round 3 of All India. Okay, next. So here, if you have any questions, then you can write and give. Next. Thank you. Jazakallahu khair.
Jazakallah, Dr. Muhammad Ubaidullah. Now I request Dr. Sadiq Kazim sir to present a moment to Dr. Muhammad Ubaidullah sir.
नहीं लैपटॉप रेडी करना उसके बाद बात
Moving on to the next session, we have state PG counseling process by Dr. Syed Nurullah, MSc ND.
Right. Assalamu alaikum and a very warm good morning, one and all. Thank you, Dare, for inviting me here and giving me this opportunity. Well, the panelists have been wonderful. Thank you, Abed Bhai, for this classification of AIQ and state separately. And thank you to all the audience for making all the space on a Sunday and being here. So let us not waste much of the time. Well, it is very easy, to tell that All India counseling क्या है, state counseling क्या है. घर पे बैठ के रोटी बनाना बहुत आसान है, बोले ऐसी बात हो गई है. तो it is not that easy. The thing is, you have a NEET PG exam. You give an exam. The target is straight. It is straight. Like you have to study, go with the grantors, give your everything, energy out, and get a rank, get a seat. The target is straight. But now, coming to the counseling aspect, it involves a lot of things. It is not that easy. During this phase, your mental composure is of utmost importance. Let me mind you again, your mental composure is very, very important. So let us not waste much of the time and start off. So who all are eligible for state counseling? So first thing is the people who have qualified, they can register in All India quota 50% seats and state quota 50% seats. So state quota 50% seats include what all? So state quota includes, first thing is, it includes all the 50% seats of the government medical colleges and as well as private medical colleges. Okay, so the private medical colleges is again divided into multiple things. It is divided into category A, category B and category C. So category A is involved with convener quota that will be dealt with KNRUHS, and All India quota already Abed has already discussed it. So category A will be included in convener quota, and category B and category C will be included in management quota. The counselings will be done separately for both convener quota and management quota. The notifications what you get are separate. The websites that are included are separate. Okay. Then what is the eligibility criteria for state quota seats? It is we have to get qualified for the exam, the first basic priority. Then second priority, which is of utmost importance, is you should be a local candidate. Now the local criteria of lately the state government has specified that you have to study for at least consecutively 4 years of the previous education. So basic take home message is, if you are done MBBS from Telangana, you are a local of Telangana. If you have done a medicine from MBBS or your degree from foreign medical graduate, you cannot be considered under the local criteria. So that things, the court case is still going on. We need to get more updates on that. Inshallah, we'll be further updating on that. Then Qualifying criteria for state counseling is OBCs. There is no such OBC as such in state counseling. BCs are very classified. Backward castes are very classified. So you should know that BCE, especially people ask me who have got 40% percentile, they can register for counseling. So for OC category, it is 50. PWD is physically handicapped category, they have 45, and BCs can register with BC, SC, ST with 40 percentile. Right? Then coming to the next slide, reservations. What are the different reservations what we have in state counseling? It is very straight. They have crossed the 50% barrier, by the way, and there are 29% reservations for BCs, 15% for ST, and 10% for ST. Right, so now 29% what we have is 7% for both BC A and D, 10% for BC B, and only 1% for BCC. So basically, a person belonging to BCC is nothing but an OC, right? Basically, in OC, there's just 1%. I don't think it's going to calculate much, and BC is 4%. These all are vertical reservations. Then we have something called as horizontal reservation. This will be done for females and as well as physically handicapped candidates, right? Then, as I mentioned earlier, candidates who are domiciled of other states cannot participate in state counseling. This is as per the previous rule that has been recently given by GO 50, that is being under question by High Court. So we need to wait for further updates on that. And person with disability have got reservation just 5%, right? Now there is something called as in-service candidates. In-service candidates are people who are doing a permanent government job. They do job in two places. One is rural areas and one is the tribal areas. So people belonging to the tribal areas, they have got reservation and as well as they have an addition of marks. So first they'll get addition of marks to the marks what you have been allotted. So the first thing is how many marks can they be rewarded? If you have done service, this is a permanent job. This is not a contract. This is not an outsourcing. There is no such job. It's only a permanent job what I'm talking about. So if you have done in tribal areas and you have done for 3 years, so per year you'll be awarded 10% of your marks. And if you have done in a rural area, you'll be awarded 8% of marks at max for 3 years. That is 10 into 3, 30% of your marks will be added. And for rural areas, it will be 8 into 3, 24% of the marks will be added. Right? So this is a big benefit for the people who are already doing the permanent government job. Then apart from that, I already told they are having in-service reservation. So how much reservation they are having, you can just see they have 20% of the seats reserved for clinicals and 30% for paraclinicals. And last year, High Court gave a judgment that all the diploma seats that are there should be reserved only and only for in-service candidates. So a regular candidate cannot participate for diploma seats, right? Then next, it's a very important slide. There was also a discussion, but I contradict to the discussion what has happened here about the second degrees. Because these are the rules very straight away framed recently by LMC. Candidates who have completed a postgraduate degree or DNB will not be eligible for admission to any other postgraduate degree or diploma. If a person has done something like MD anatomy, he cannot do MD SPM tomorrow. If he has to do, he has to forego his registration of MD anatomy. He can write a NEET exam, but he cannot participate in counseling until unless he forgoes his registration. That is the rule number 1. Then the rule number 2, what we have is candidates who have already taken a diploma. Let us presume someone has done diploma pulmonology or diploma PSM. They cannot opt for another diploma or some other, like, they have done diploma pulmonology, and after writing again 2 years, they are again writing NEET and they are opting for something like general medicine. That is just not possible. So whatever diploma you have to take, you can do MD or MS in that specific department only. I hope these 2 rules are recently added by the NMC. Please follow these rules who have already taken 1 degree. Then EWS, luckily we got this year, a High Court judgment has come just few days back that from this year onwards, 10% seats will be included in all the criterias. Like for all the reservation, 10% seats for OC candidates. So EWS is only for OCs, not for BCs. So 10% seats this year will be seeing in seat matrix. Right? Then after going through all the reservations, now we come to the actual chronology, the order of what the counseling is all about. So basically first you have to see the notification. After notification, you have to go and apply. You have to fill up the application form. After application, verification happens. After verification is completed, then you get a provisional merit list. After the merit list is done, then you have web options, and web options ke baad last thing is allotments. So we'll be discussing each stage separately. So this is what the chronology is all about. Okay, right. Then most very important website, very important slide, which has got all the websites you have to keep on looking every day. Try to bookmark these websites or try to save them in your quick access. Please see these websites daily for any kind of updates regarding counseling till at least your counseling process is completed. The first website is MCC, then second website is NMC, third is about NBE, fourth is KNR UHS. The first three websites, MCC, NMC and NBE, it's all about All India Counseling. You have to be sure about these. Then KNR UHS, TS, this will release the notifications of all the statewide counseling related stuff. KNR UHS. Then TSPGMed and pvvt.tspgmed.ts, this website. TSPGMed does counseling for convener quota. pvvt.tspgmed does counseling for management quota. So any notifications pertaining to that, you can just cross-verify with those websites. Then even before I start the process, let me tell you one very important thing is your registration and processing fee will not be refunded once it is paid. Yesterday or a few days back, someone messaged me, sir, by mistake I registered for Andhra Pradesh management quota, even though I was trying for convener quota. Now I don't know what to do. Can the university transfer my money to this? I told it is not possible. Once you have paid, even though you have not uploaded the documents, once you have paid, it is done. It is never, university will never give you back your money, right? Then this is another important slide. The certificates that you need to keep it ready. So starting before taking the photos, please just listen to me. The first thing is starting from your 10th class certificates, 10th ka memo. Second thing is you have to keep inter memo ready and TC ready. Then third, MBBS individual year marks memo is not required. Just a transcript. If you have not applied for it, please apply for it. It will take minimum 1 month for transcript for you to get that, because transcript has got the duration of how many times you have taken to pass and as well as your marks, right? Then apart from that, your MBBS registration, MBBS degree. This is related to your studies. Now coming to your caste certificate. Caste certificate has to be there, your minority certificate has to be there, and gap and all is not required right now. It's only for uploading the documents. And the last thing is your EWS certificate, if EWS applies to you, right? The caste certificate has to be the latest one. So I'll be detailing about all the, if you want the photo of this? No, right? I think I've already shared in the group this photo. Right. Then detailing of all the certificates, like where to get from what certificates, sir, where to run from pillar to post. It's not required. I've detailed it out. People ask, sir, we already have a caste certificate BC. Is it not sufficient to have is it not a minority certificate? No, it is not a minority certificate. Minority certificate is separate and caste certificate is separate. Both are separate. You should have both of them, and both have to be released from the Tehsildar office only, right? Then why is minority certificate required? Minority certificate is required because you want to take seat in a minority institution. Simple as that. And caste certificate to avail the benefit of the caste. Then there was a rule, as I told you, the GO50 is challenged. So we don't know what, there was a query recently asked to me about Siddhartha Medical College, like as it is a statewide institution, whether it will be, any reservation is provided in that or not. So we have to wait for the prospectus, everything will be clarified. Then EWS certificate, the validity of EWS certificate is only 1 year. So you see when it was issued, from that date, only 1 year it will be valid, right? Then BCE, generally it is accepted only after 2019. Any caste certificate after 2019. Now coming to the OBC caste certificate for the central counseling, it is validity is only 2 years. So after every 2 years, you need to renew your OBC certificate, right? So most of the certificates that you have about caste after 2019 are valid. Before that, please renew them, right? Then after payment is received, you will get a message on your phone that so and so candidate with so and so rank it has got this registration number. Kindly save that message, bookmark that message, and keep that message with you. See that it does not get auto deleted. Right? You have to upload all the documents, and after uploading the documents, now there's a query that has asked, sir, I'm a Muslim candidate, but I'm not interested in taking seat in minority institution. Is it mandatory for me to upload minority certificate? So the answer is, there's a question in application form. Are you a minority? Yes or no? If you tell yes, then you will have to upload the certificate. If you tell no, it is not required to upload the certificate. Understood? So the things are very clear. So whatever you enter there in the application form diligently is going to be asked to upload that and certificates. I hope it's clear. Right? After the uploading is done, then you have to save all the things, and then a page will open, it will pop up, and it will ask you to print the application form. Store a soft copy with you and also keep a hard copy with you. Right? After completing the application, I hope the application process is absolutely clear. Right? Now coming to the second step is verification. Verification is done online. Right? Verification, it will be shown to you that it is completely online. During the process of registration itself, you will be getting messages that verification has already started for your candidate, and you have to keep on checking your phone if there is any query being raised by the verification officer. If a query has been raised by the verification officer, now let us presume you have submitted a certificate which is wrong, or certificate that is missed by mistake, we don't know, human error. So at that time you need to upload it immediately. If you don't upload it, what will happen is your chances of your registration getting cancelled is very high. So you should be very prompt in answering the verification officer queries. Then, as I told you, you know, ये पूरे फसाद की जड़ मोबाइल है. It's a very common saying. So this mobile phone, आपका number, it's very, 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 very important. See that the number what you provide is working 24 hours. It has good balance, it's in good network zone, and you keep getting the messages from KNR UHS for being updated. Okay, so this mobile number is going to help you from the day of registration till you are allotted a seat, till the counseling gets completed. If by mistake you lose a phone, see that you have SIM replaced very immediately. See that it is not getting delayed. Right? So even after completing the choices, you will get a one-time password even on your mobile phone only. It's the same number what you give at the time of registration. And now the KNR UHS has added a very good, when I was doing this NEET UG ka help, in that I have seen that KNR UHS has added one more thing. It's that anybody who tries to, give another number during the registration or during the web options, the system is not accepting your number. So you have to have that registered mobile number. It is a very, very, very mandatory thing. So see that your phones are working from the day of counseling itself. Right? Then comes a notification that you can start exercising your web options on so and so website. So as I told you, there are two websites, TSPGMed for this convener quota and pvvt.tspgmed for management quota. Once you start that, see, first and foremost thing is the very common question that students ask me is, sir, is there any limit for web options? There is no limit for the number of options that you want to exercise. You can exercise as many options as you want. In fact, there has been miracles that has happened to many of my students who have opted for an option which is 170th and they got selected with that. So you can even select 220 options, 230 options, irrespective of your choices. So there is no limit, there is no bar on the option of exercising the number of options, right? Then, so whatever you are interested in, try to exercise in that, irrespective of whose choice is that and whatever. So the number of choices keep varying. Don't see, it's not an exam to copy someone else's choices. अरे तुम क्या लिखे जरा बताओ, मैं तुम्हारे options देखता हूँ, मैं भी वही देख लेता हूँ. It is not an exam. Your choices are totally individual and independent, and it's totally like whatever you want and whatever you're not interested, right? So as I've shown you, this important instructions will be there on the left side. Whenever a verification officer puts a query, it will be lifted on the left side, and on the right side you will be having
the web counseling, web options, the list of the colleges, detailed notification, and the individual seat matrix. Everything will be written on the website of TS PG NEET. If you open, on the left side will be the list of certificates, verification queries. On the right side, you have to give the web options. You have to click web options. After clicking web options, the second thing that opens is this instructions. Once the instruction open, you have to just blindly you have to tell I have understood. There is no other option. Okay. Then after opening this I have understood, now you have to open another form. This option form includes your registration number, your rank, and your mobile number. And then after that, you have to click get OTP. Once you click get OTP, a message will be sent to your phone where you get the OTP. After that will be a worded coded sentence. After putting that, you have to click validate. If you validate, the next page that will open is this of web options. Understood? It's very simple. You have to enter all the details here. After entering the details, the next page that you have to validate. Validate karne ke baad, the next option that will open is this. In this, you have to give the web options. On the left side, colleges will be mentioned. On the right side, as soon as you keep selecting, it keeps on adding on the right side. Then after that, if you see downstairs, there is something called as add, delete, modify, save and log out. Left side, the colleges will be mentioned and the branches will be mentioned. You have to click add after each and every option, whatever you're adding. Now, if you, let us presume you have added by mistake, you can just directly delete it. And then you have randomly selected all the options. Now you want to modify it as per your choice. You want to make it a diamond. Then you have to keep on modifying till the last moment. After modifying till the last moment, the last thing what you get is save. You have to click save. If you don't save, your options will lose. Your counseling will be lost. That phase of your time is lost. Okay, and there is no limit to the number of options as I told you, right? And then let us presume by mistake you have logged out. Again, as I told you, the options won't be saved. If you click save, the next page, a window pops up with this. It shows automatically your roll number and your rank will be mentioned. In that downstairs again it will be written get OTP. Again click get OTP, confirm the OTP, write the OTP, and that is the end of your saving of the options. Right? So the process is very clear. I hope everyone understood. Right? If you want me to repeat, I can repeat. No? Right? So there's another query that is being asked, sir, I've put option at 3 o'clock, at 5 o'clock I got a dream, I want to put another option. Is it possible? Yes, it is possible. Right? You can edit as many times as you want until the last moment, but see that it is not the last moment. ठीक है? It's not there है दुरुस्त है, यहाँ पे दुरुस्त नहीं होता. This is technical errors that happen. दुरुस्त हो ही नहीं सकते हो. यूनिवर्सिटी को कॉल कर लो, आप किसको भी कॉल कर लो, कोई भी फोन नहीं उठाते. आप मेरे को मैसेज करते, I can't respond to that. समझे आप? It is not there है दुरुस्त है. It is सही टाइम पे है. तो सही टाइम पे सही ऑप्शंस सही प्लान कर लेना. And this is the right time to plan all out. Okay? Right? Then is there something like freezing and locking in state counseling? No, there's nothing like freezing and locking in state counseling. It automatically gets locked. Okay? Right. So I have completed the process of application, registration. Then next stage is verification. I have completed of how to give web options, technically how to do it, and then we have completed with confirmation. And now comes the biggest stage, that is web allotments. How does a web allotment happen? So basically, how many rounds of counseling are there? So basically there are 4 rounds of counseling in state. Round 1, round 2, round 3, which is nothing but mop up, and last round, that is stray vacancy. Okay, round 1 and round 2, these are nothing but a basic mirrors of whatever you are having. Round 1, university follows a rule, GO 505, as per which they can release 70% of the seats, but they will save 30% of the seats for further phases of counseling. Understood? So round 1 allotment is not the mirror of what your actual allotments are. Round 1 allotment is very clumsy and very bad, horrendous. You will get sleepless after seeing the allotments. So round one allotment is not the actual mirror. So don't worry, don't panic out after seeing round one allotment, because most of the OC seats will be released out in round one allotments. It's only in round two and round three that they add a lot of castes and all that reservations, right? So that is about each and every rounds. Now, how does seat allotment happen? If you see the seat allotment, there are a lot of NS and S. NS stands for non-service, S stands for service. Okay, that allotment, different phases, you can lock it out and check it. Now, while filling the web options, I want you to be very cautious. You have to be very diligent, because every round. Now, let us presume what has happened in 2022. There was one of my junior. He had a 16,000 All India rank. Now he got general medicine in Shadan, and he was baffled by the allotment. He was like, sir, मेरे को खुशी से समझ में नहीं आ रहा कि मेरे को क्या हो गया, because 16,000 never it has been allotted general medicine. The reason is the people above him did not prefer that option. The people above him have not preferred. That's the reason he got the allotment. So there are multiple factors when web options happen, when web allotments happen. So I will tell you only one thing is, you have to be aggressive from first round itself. Okay? Right. Then after announcement of allotments, you have to download the allotment letter from the university by paying the university fee, and then you have to report to the college physically with all the documents. The documents will be saved by the college. They will not return you anything. Right? You'll just get a certificate or token of certificate that what you have submitted XYZ all the documents. Then you have to keep that. That's the only thing what will be given back by the college. Right? Physical verification of all the uploaded documents will happen only at the college. There is no other venue for it. At the time of reporting, there will be an undertaking what you have to give, that I am not going to quit this seat. If I quit, I will be paying 50 lakh rupees penalty, and I will be foregoing for 3 years my state counseling. That is an undertaking what you have to give. That is a discontinuation. This undertaking is about that. Then about second round of counseling. It is on the same lines of first round of counseling. There is no much difference. It is just that you have to know who are eligible and who is not eligible. So if you have registered and if you have participated in counseling and you have kept options, after putting options, you are allotted a seat. If seat is allotted, you have reported, then you are eligible. And if seat is not allotted, it's okay. You can again participate in second round. Now there are few great minds who do not register and they think it's easy for them to crack. Then they don't even keep options from the first round. They think that they'll directly put option in second round, which is not possible. Okay, so you have to keep web options from the first round itself. Okay, to be eligible in further phase of counseling. Then after that, the same allotments, everything happened same like round two. Then you have come with third round, that is mop-up round. Mop-up round is completing all seats of state counseling. They release every seat. Everything will be very crystal clear in the seat matrix. Nothing will be hidden from you. Everything you can see in the seat matrix, what all seats are there in whichever category. Now there are, few people who have this, difference of opinion. They tell that, sir, I will put options seeing the seat matrix. This is not right. This is not how you do the web options. You have to have your priority of list right now. This is the time what you're getting to just, sort out the things what you want. Which branch you want, which college you want, and how do you want to do it. This is the time. Then coming to who all are eligible and not eligible for mop-up. So the first thing is who are not eligible. Eligible is, we got this rule last year only. Until last year, the rules were as for All India only. The same rules were there for All India. But by God's grace, we got this permission last year that whoever has taken seat in round 1, whoever has taken seat in round 1 and reported, round 2 and reported, they can further go for upgradation even in mop-up. Right? Until last year, this rule wasn't there. Round 2 was the last round. There was no upgradation in mop-up, but from this year again you can participate even in mop-up. Right? Then who all are not eligible is seats allotted in previous rounds and they have not reported. They are not eligible to participate in mop-up, and who have not exercised the verb options again from the first round. Right? Then what is seat blocking in state counseling? Seat blocking is, It's like Ajay Devgan walking on two places or two horses. If you remember the scene, I want to run even all India. I want to run even in state counseling. I want both the seats, sir. What to do if I'm losing both? See, after getting a choice of yours, the other seat you have to automatically resign. You can't be like that. You can't be so selfish. You have to be selfless in this matter. So, to the people who take the seat in mop-up and stray vacancy round and they don't report, they will be considered seat blockers, and university has levied a huge penalty on them. The penalty includes 50 lakh rupees of bond, like you have to furnish. Then second thing is you will be debarred for 3 years. Okay, so this is a penalty for seat blockers. Then the original certificates will not be returned to you. As I told you, only a custodian will be given to you. And the reason is, the last point that I've mentioned is, whenever inspection happens, the inspector has to cross verify all your documents. Okay. Now, what about stray vacancy round? The rules are very clear, same like all India. If you have a seat, basically I want to tell you in layman's language, if you have a seat anywhere, you cannot participate in stray vacancy. If you are having a seat anywhere, you cannot participate in stray vacancy. And if you have left seat in mop-up, also you cannot participate in stray vacancy, be it all India or be it state. So if you are allotted and you have to compulsory report in that stray vacancy, or else again you'll be, as I told you, you'll be considered seat blockers, right? Now, who are not eligible is more important in stray vacancy. Allotted seat in previous rounds of state counseling and reported, did not participate in web options of the first phase, did not report in previous allotment rounds, and then candidates who are admitted in MD, MS in all India or state or any other state, they still cannot participate in stray vacancy. So I have completed all the rounds of counseling. I hope everything is clear till now. Then most important point is, if you're getting a seat, let us presume you're getting some seat, pre or paraclinical through all India and state, the same seat you're getting, because of the same rank you're getting the same allotment. So try to take that seat through all India, don't take to state, because state someone else can get it. Okay, right. So this is how you put the web options. There are few tips I can give you. Even Obey has tried to give few tips, but I'll make it little more, abridged version I can tell. Right. So you can select the college, you can select the course. You have to divide in between clinical and non-clinical. You have to divide in between degrees, diplomas or DNBs. And then you have to decide between surgical and practicing fields. And then you have to decide between government and private, and local of Hyderabad or non-local of Hyderabad. You have to sort out these 6 questions. These 6 questions are very important. You have to sort it out right now. Then you have to check into the number of colleges. You can see the previous allotments. You'll get the list of the colleges. A few colleges like Mallareddy have been out of counseling because they have been converted to deemed. So we'll be losing a huge chunk of seats from Mallareddy, both women and general. So Mallareddy is not going to be there in state. So that is a big loss. So probably I'm expecting few government seats to pop up and help you students out. So that is one way. So you need to sort out different colleges, like new medical colleges are also getting PG seats from this year, inshallah. So in that you will have to list out the colleges wherever you can go, wherever you cannot. Like few government medical colleges that have recently come up, I can tell you GMC Nizamabad, GMC Mehboob Nagar, GMC Siddipet. These 3 are giving a very good quality and very good standard of education. Both the faculty is good, the patient load is very good in almost all branches, and they are trying to improve it every probable aspect because the principals are very strict there. Right? So these 3 you can also prefer them, apart from the colleges that I have mentioned here. And then after seeing the colleges, you have to see for the branches till what all level you can compromise. It is only during now that you can think in the normal phases, because once the counseling starts, it is basically panic buying. In panic buying, you'll definitely do mistakes. It's not sure that whether you'll be taking the right decision or not. So it is right now the choice what you have to make, what all options you can keep and what all options you can quit. So basically you need to start with a small list. Like, what I generally tell to students who personally contact me is, close your door, sit alone, see previous year's allotments, make a list as per that. Start with government, start with MD or MS, whichever is your choices, then go to private. Private, even VRK has got seats, okay, for girls, not for boys. Right. So even VRK has got seats from last year. Even though one seat here and there is available, but yes, even that you can keep. So you need to construct that list in a very beautiful manner so that you don't have confusion tomorrow. You should not think कि अरे ये तो option था ही नहीं मैं कैसा डाल दी. A person has mistaken FM, which is forensic medicine, to family medicine, and has taken that seat. So this is the time to know which option is what. And the most common question what people get is what is DTCD? DTCD is Diploma in Tuberculosis and Chest Diseases. It's Diploma Pulmo. And someone got confused for DO. DO is what? Nobody knows. Diploma Optal. So you should know mnemonics of each and every department. You can't keep that option and tell, sir, I got this by mistake. I don't know what to do. No, I can't quit now. You should know what to do right now. This is the time to decide all these things, not tomorrow. You can't keep on procrastinating it tomorrow, right? Then there is a 1 year service, what we have in Telangana, which is, if you don't do that service, you have to, actually this is an old bond. Court case is also going on for this, and the bond is of 20 lakhs, not 10 lakhs. Okay, so a person who has taken seat in convener quota has got to do in government. A person who takes in management quota will be doing in the same college. SRship, right? And there is a new criteria that has been added by NMC last year, that a person who takes seat in MD, he has to pass out that seat after completing the course within 4 years. And a person who has taken a diploma, he has to pass out that seat within 2 years. If he or she is not able to do that, then their seat will be cancelled. Okay, right. Then I have completed whole of convener quota. I hope everything was clear, right? Now coming to the deadly thing, you can call dead attack, BNC, that is management quota. I don't know how many are interested in management quota. How many are actually interested in BNC category here? Any hands? Hey, raise your hand here. Don't get embarrassed. There's nothing wrong in it. Soulless girls for BNC category. Don't lie. Come on. Right. So now what we have is the same thing like what we have for convener quota. Same way you'll be getting a prospectus will be released. Same way you'll be applying for it. The application, everything is the same like convener quota. There's no difference between convener quota and management quota. Now where the difference comes? Now basically I told you private college seats are divided into private A, B and C. Now private A is anyhow included in convener quota. Now private B and C, what about those seats? Now how much is their percentage? Private B category seat is nothing but MQ1. Management quota is divided into MQ1, 2 and 3. If you see down, this one, management quota MQ1 is nothing but B category seats which include 25% of the seats, right? And then management subcategory NRI quota includes 15% and institutional quota is nothing but 10%. C category is nothing but full cash rich category. Okay, C for cash rich. जिसके पास पैसा है वो लोग C category में जाते हैं. जिसके पास middle class and upper middle class will be struggling for B category. Let me be very honest because since 5-6 years I've seen a lot of students somehow they compromise and they get into B category. Right? So this MQ1 category, I call it more dangerous. In further slides, I see that you all are sleeping right now. You all will wake up, right? So if anyone is having NRI issues, they can contact me personally because NRI has got a lot of documents that you need to submit. And institutional quota is basically like which is C category, which is having only 10% of seats. You basically go to an institute. You tell them, sir, I'll be offering you this much. Can you give me this seat? They'll be like, okay, your offer is very humble and very generous. We'll give you this letter. Please go and apply this. You'll get the seat. All you have to do is just put only one web option in C category. That is institutional quota. Now coming to the NRI quota is little bit just like, gamble game. You don't know when you'll get allotted. And B category last year, if you see the point down, there are no reservations in management quota. It's purely management quota. As I told you, M for management, M for money. You have money, you come here. You don't have money, please go. We don't entertain any reservation. Simple. You have money, you come and you join. If you don't have money, no need to come. All the minority medical colleges will try to admit as many minority students only in B category. But if you in C category, even non-minorities can enter. Depends on how much you are ready to pay. Simple as that. Okay, right? Then this is the most deadly slide of my all slides. It's going to wake you up all, as I told you. So what are the different fee structures what we have? So what are the different fee structures what we have? Now if you see the list of the fees here, it's never ending. NMC releases a rule, hostel is mandatory. Now private colleges have started collecting money in that. NMC releases a rule, bank guarantee is mandatory, bank guarantee fee they are collecting. Basically, private colleges, where before 2017, they were directly sucking your blood. But now, thanks to the central government, they have given an indirect way to suck your blood. So, what are different ways to suck your blood? So, first comes, you get allotment. First, you pay registration application fee. For A category, it's around 3,000 to 4,000. B category, even though you're applying the same, they'll be charging you 7,000. Why? We don't know. Then second, after application, then comes seat allotment. Your allotted seat, you have to download the application, you have to download the allotment letter. For A category, they'll be charging around 30,000. We don't know why they are charging that huge, just to give a piece of paper. And then for B and C category, they'll be charging you 70,000 to 80,000. Just university fee. Right? Then after that, then comes, you go take that allotment letter, you go to the college, sir, I have given allotted seat. That clerk will be an idiot, he will be dealing very badly with you. So what if you have come, you have done big thing for me? No, sir, please allotment, sir, tell me what to do. Then what he will tell is, have you seen the fee? That fee is very important. The GO, what has been released last year, is still under question by the High Court. The matter is still going on. An interim relief has been released last year by the High Court just on moral ground. Tomorrow it can even get quashed. We don't know that. I'm hoping that it doesn't get quashed. Okay. So what is the fee that you have to pay? So for private A category, you have to pay approximately 60% of the proposed fee. If you see Bhaskara fees, it is 7,50,000. So approximately how much you have to pay of the proposed fee is 60% of that for A category is 4,50,000, right, for A category. Then coming to the B category, it's 23 lakhs. So you have to pay 70% of that, which is approximately 16 to 17 lakhs per annum, right? Then this is a basic structure what you have to understand. Then comes bank guarantee. Many people have questioned me, what is bank guarantee? Bank guarantee is nothing but, apart from Shadan, rest all colleges take you bank guarantee, including Deccan. Last year they have forced a lot of students to pay bank guarantee. What is bank guarantee? Is basically a parent's guarantee that you will be ready to pay the second year fees. Okay? So the thing is, bank guarantee is nothing but you should be ready. So bank guarantee you should be ready to pay, okay, for second year fees. So how much? It's equal to what you have paid in A or B category fees, right? Then coming to stipend fee, this has been started by our beloved Deccan Medical College, which has given that you have to pay for 3 months. For 6 months, approximately 50,000 per month. So whatever the proposed fee is extra, you have to give 3 lakh rupees. Okay, so imagine your fee for Deccan College is approximately 4.5 for A category. So you have to pay stipend fee for extra 3 lakhs. Okay, that is 7.5 here calculated. Then coming to processing fees, under the table fee. They will take you how much ever they want. Imagine you are going to a very lavish college like Apollo, they will be charging you 70 to 80,000. Or if you are coming to a Gharib college like VRK, you will be charged 30 to 40,000. Okay, depends. Under the table, whatever they want to charge, they will charge. Then coming to hostel fee, it's like you have to pay approximately 2 lakh rupees. It is mandatory in almost all colleges except for Shadan and SVS. As far as I know, there is no hostel fee. Right? Now if you calculate all this, just put an average of how much you will be paying in all the colleges is like 4.5 lakhs for that, 3 lakhs for this stipend fee of 7.5 lakhs, then university fee 80-90,000, then processing fee another 45,000, hostel fee included, approximately 10 lakhs you're getting for A category. Okay, right. Now this is a very important slide in my presentation. What all you'll be have to think about it? What are the different issues that you need to think about it? The first issue that comes is scholarship. Where to avail it? It's on ePass website. It's available for all minorities and non-minorities as well. Okay. What all you'll be getting back in scholarship of all these things? Any guesses? You'll be getting all 10 lakhs. You'll be just getting 4.5, that is processing fee. Rest all we don't know when we'll get, or we'll not even get, we don't even know that. Okay, right. Then that is scholarship. Then scholarship is only for A categories, not even for government, not even for B and C categories. Then student loans. I told you, right, lot of upper middle class students, they try to push their limit, they try to push their parents to like, छोड़ो ना एक थोड़ा शादी बाद में करते पहले सीट ले लेते, ठीक है? तो in that scenario, what they do is they try to push their limits and take B category seats. In that, they tend to go to all these banks, and the banks charge huge interest. Interest is approximately 9% right now for student loans. How much? Let us presume for B category you are paying 16.5 lakhs. EMI what you will be getting per month on 9% interest is approximately 45,000 per month. You have to pay that. I don't know how you will get that money because stipend is not there, right? Then third thing, after paying that 45,000 till the end of, let us presume you have paid for a tenure of 5 years, approximately 16 lakh loan is becoming 21 lakhs. So you'll be paying extra 5 lakhs for the bank. Understood? So this thing of student loans is very, very bad option. I will tell all the students here, don't take student loans. Go to your relatives, beg, borrow, buy, whatever you want to do. Like I know one of the students in 2021, she's right now a pediatrician. She didn't have money, but she had land. So she did barter system. You give land, I give you seat. Simple logic. So someone gave their land equating amount of money in C category, they got the seat. So even land is one of the option. But see that don't take loans. Please don't overburden yourself. Okay. Then there is something called as, sir, I got seat in B category. I want to jump to A category. I want to jump to All India. Don't do all this mess. Unnecessarily you'll be like tangled in somehow manner that you don't even know where you are. End of that you're like, मेरे को seat मिली या नहीं मिली, मेरे कुछ नहीं मालूम. Understood? So don't be in that mess, to be honest. Then this year, this is a very important point that I've mentioned. Until last year, you have seen a very beautiful allotment, 50,000 getting general surgery, 52,000 getting something clinical. But from this year, the allotments are not going to be the same. The reason is every year, alternatively, 1 year management quota seats will be given more, and another year convener seats will be given more. So this year we have less convener seats and more of management quota seats. So B category seats are more and C category seats will be more when compared to A category seats. Then the last thing that is there is 0 percentile. Just pray that it does not happen. If it happens, last year it was a mess of seats. People of private medical colleges have sold C category for horrendous rates. I can't even tell you the rates. If I tell, you'll just be shocked. General medicine seats were sold for 4 crores. Derma was sold for 4.5 crores where the department had a lock. I personally did counseling for a lot of students, so I know. Personally visited the college. And when I asked the principal, sir, you did not have recognition for the past 2 years. And you got recognition this year. And suddenly you are jumping the jack. When I spoke to you on phone, you told 1.6 CR, I came to the college. Now you are telling me 3 CR, you told, pal बढ़ रहा है. And what nonsense. Say you didn't have, that is a political strategy, man. You can't play all these games. You take this seat, you are taking for 3.5 or not. One category boy standing there, one गिराक is there बाहर, उसको मैं 4 में दे देता हूँ. आपको लेना है लो, नहीं तो बाहर चले जाओ. This was the mess that happened in 0 percentile. A person with 6 6 percentage, a percentage 4 percentage, who don't even deserve to qualify. Horrible mess it was. Then, right, then as I told you, there are few new rules of CQ that you have to know. There are no fresh registrations. Like until last year, what people used to do is they used to take up, sir, हमारा तबीयत खराब था रजिस्ट्रेशन के टाइम पे, हम जाते हैं हाई कोर्ट से ऑर्डर लाते हैं, यूनिवर्सिटी में सबमिट करते हैं, एंड दे ऐड टू द लिस्ट, मेरिट लिस्ट. Until last year they entertained. This year I sent 3 candidates in UG and all of them were rejected by the university. So if you are doing registration on time, this all mess will be cleared. So you see that you have registration on time, and then you have to start exercising web options from the first round. You can't directly jump the jacks in the second round, right? Then and one more for bank guarantee, as it is, for B category, it's a little difficult to submit all 35 lakhs for middle class students. University has given this option that you can submit bank guarantee till 1 month. Okay, you will be given 1 month time period to furnish that. And after second phase of counseling, admitted candidates will not be permitted to withdraw from the seats. If you are doing that, then you'll be considered in seat blocking. Then MQ new rules are, imagine there are few seats that are left out, and that seats will be sold out by the medical college. They have that veto power to sell it as per rate. Okay. Then there is a very important thing called as gift of life. All the PG students need to understand that. So whenever you're deciding a branch, you need to understand the gift of life. I know, big consultants are sitting here. I'm too small in front of them. So the thing is, you need to understand what is emotional quotient and what is intelligent quotients. Emotional quotient is, as I told you, you need to have good relations with your relatives or friends. That helps you get to that level where you want to be. Intelligent quotient is your personal thing. It's a selfish act, totally. You're doing for yourself. But emotional quotient is a very important factor. Last year, we have seen just few months back, a radiology resident from MAMC did a suicide. Last year, Dr. Ankit Diora, I think his name is, he did from AIMS psychiatry. He was doing psychiatry and he was in severe depression and he still did suicide. So, when you don't have an emotional support of family, relatives, you might close the door of hospitals and do working hours for 36 hours together, but at the end of the day, you have to go back home. You should also consider the people who are in home. You should also consider that. You cannot be like, I'll think only about myself and neglect what is there in home. Because the people at home look for you, and if you fall sick, tomorrow someone will replace you, but there is no replacement if you fall sick at home. Understand that. So emotional quotient, while selecting the seats, especially for boys, don't go into people who talk orthopedics is king of all subjects. Anesthesia is your behoshika doctor. No. There was a student who messaged me and told me, sir, I have so and so rank. They are telling I'm not getting any seat. What should I do? I told him, if you are not getting of what others are telling or what you want to take. He told, what I want to take, I'm getting that. But what others are telling that orthopedics is good, medicine is good, surgery is good, I'm not getting that. So I told him only one thing. Is your family ready to accommodate you for another 1 year sitting at home? And his answer was straight no. My family is not ready. See, boys have a burden of financial things. I don't appreciate boys sitting for too long. Understood? And if this is your hard attempt, just go and take the seat. If you think there is a scope of improvement, sit back and take all the risk. But if you are sitting back at home, you'll be cursed. You have to face all the frustration. Be it girls or be it boys. It's for both. Your parents will not appreciate you, will not tolerate you for more than 1 year sitting at home. So emotional quotient is very, very, very important when you're selecting the seats. And have you ever played chess? If you have seen that, there are pawns in front and there's a king and there's a queen. So I'll relate the pawns to relatives. All the pawns are equally important to win the game. You lose one pawn, it's basically a little bit, you'll be shaken here and there. And king, you're the king of right now. And the queen is basically money. If you can sacrifice queen at the right time, you can probably win the game. Understood? So these are very important things. And penultimate slide is miracles do happen. Please believe in miracles. Don't see the allotments. Don't see what XYZ person has got. अरे इन्हें तो मेरा competitor था, इसको मेरे से better मिल गया, मैं क्या करूँ मेरी जिंदगी में? Don't try to bang your chest. Don't cry. Don't cry in front of parents. They're already weak seeing you so long. So don't do all that messy stuff. Just believe in miracles and don't stick with that itch. Itch is medicine itch होना, periods itch होना, gynec itch होना. This itch is very bad itch. We don't even have an itch guard for that. Understood? Please don't stick with that. Try to relax. Be flexible with the options. Like when I was in your phase, I was like, जो भी मिला as a madam told, passion. कुछ भी नहीं मालूम क्या है passion. जो मिल गया ले लेंगे चलो. ले लो ENT. I got ENT. I took ENT. I did not even object, even though there are so many ENTs in my family. So the question that arose was already, when I came out, many seniors were like, why did you take ENT in Shahdan? Who told you to take ENT in Shahdan? It's so bad. But now there are students who are taking CT in VRK. What do you want to tell about them? You have any comments? Tomorrow TRR will be getting recognition. What will you tell about that? Like, NMC is giving them recognition. You are nothing but you are just bound with the time. All you have to do is you have to excel in that time period. You can't tell that Falan student from Falan background or Falan student from Falan college is bad. You can't label them. Don't objectify them. And please wait till miracles happen. Miracles do happen in mob up round. You have to be patient enough. Right? And then the last slide is a very important slide, a life lesson what I learned from Irfan Khan. A very famous saying this is. Understood? Especially for boys who are taking general surgery and surgery allied branches. People, it's a trend now, I don't know, the seniors know it or not. They are only preferring the 5 creamy branches. General medicine, orthopedics, radiology, dermatology, pediatrics, gynecology, 6 branches. They just want in this branch and they are waiting for years together writing the exam, they don't know what to do. We don't even know what they are up to. See, tomorrow you are basically killing your criteria to practice outside in the market. So please don't do that. Try to compromise till the level you can compromise and see that you flourish well. I just hope and pray. Thank you all for patient listening. Thank you, Dare, for giving me this opportunity. Thank you.
Now we'll open the session for question and answers. I request Dr. Ubaidullah please to come on the stage and Dr. Syed Munibuddin to come on the stage. Right here. Audience, any questions, please? I request Dr. Sama to please moderate the session.
Any questions?
Study certificate was written there. Study certificate.
Yes.
Is it the bona fide certificate?
Study certificate, bona fide certificate, custodian is the same. All are the same. Any other questions? All India, state, during PG, after PG? Please don't ask about marriage for a second.
I'm so sorry to disturb Noor. Firstly, I thank Noor and Ubaid bhai as well as Mani for coming over here. They're doing a wonderful job. He's running a group. I hope you all are on that. If you're not, please join that group. They're guiding everyone so well. I mean, it's a boon for everyone. Because guest speakers for today, Dr. Majid Adil sir, Dr. Fahmida Banu madam is already here. We are running so late, I mean at least 20-25 minutes. I request you to please question. We can take only a couple of questions. After that, you can meet Noor, Ubaid bhai and Buneeb. We can I mean, there are a few online questions which have come. If we don't get our choices in round 2, round 3, are we eligible to apply again in straight round?
Yes. See, the rules are different. Make this thing clear in your mind. Rules are different for state and all India. Once you come out from the all India round, you can re-enter. Round 1, round 2, round 3, up to round 3, you can re-enter. But in state, if you come out from one round, for example, you didn't take admission for round 1 seat of state counselling, you will be out of the counselling. So rules are separate for different counsellings and different rounds also. So be clear in your question. For all India or state, which round you want to ask?
Thank you. Question for Noor. What is the bond amount for deemed university and how many years of bond do we serve?
Deemed university this year a mallarity has been added. So We have to wait and see. There are no clear-cut rules on the website, what we have seen from Mandareti. And for other deemed university, they follow the state bond. Other states, they follow the state bond.
Thank you. Question for Munib. Munib is a final year pediatrics PG from Osmania. Munib, psychiatry pros and cons.
One thing I can tell is there was one student 2 years back. She got 25,000 rank, so she wanted to passionately pursue emergency medicine. She spoke to me for like half an hour. In half an hour, she was like, "Sir, after speaking with you, I understood psychiatry is the best branch," and she's today pursuing psychiatry in Kakatiya. So it's all like your personal choice. Pros and cons are not there for any branch. You love it, you like it once you take it.
Thank you. One more question we can accommodate. If any question, please ask soon.
And one thing, if that person who asked about round 3, if it is about All India quota, then he is eligible for the third round. If you don't get any seat in All India quota in round 1, round 2 or round 3, then you can participate in round 4. That is for All India. And for state round, if you come out from any round of a state, then you are not eligible. If you didn't get any seat in the state round or all the 3 rounds, then you are eligible for the state vacancy round of the state.
Thank you. Over to Munib.
I would like to give few advices to people who are opting for options. One is 1%, 2% of the students will have a passion. Like, I want to become this doctor, and fixed. For them, select your branch. Half of them, more than half of them, they don't know what to select. Medicine पसंद था, ले लिए. MBBS क्यों करे? मम्मी डैडी बोले थे, साइंस में अच्छे मार्क्स आए थे. ऐसे रीजन से हमारे. तो दो चीज़ रहते हैं. एक है पैशन, सेकंड इज नीड ऑफ द आवर. अगर आप न्यूट्रल बंदे हैं, लाइक यू डोंट हैव एनी पर्सनल प्रेफरेंस, ऑल 19 सब्जेक्ट्स पसंद है, तो नीड ऑफ द आवर देखिए. हाउ कैन यू सर्व द दीन ऑफ अल्लाह सुब्हानहू व तआला द बेस्ट थ्रू द ब्रांच व्हिच यू आर सेलेक्टिंग. Second, already Usama sir बोल दिया कि first gain knowledge of all the things you have, then मशवरा करो, third istikhara. I'll just want to keep istikhara the first and then this all these things, because that's what we do in Surah Fatiha. इय्याका नस्तईन पहले है, फिर इहदिना सिरातल मुस्तकीम. Without asking Allah subhanahu wa ta'ala, the sources which you look for will also hamper your things. Like आप ऐसे वैसे आदमी से जाके पूछेंगे ये ब्रांच ले लो, इसमें पैसे ज़्यादा है, ऐसे एडवाइसेस मिलते हैं. सेकेंड इज अल्लाह सुब्हानहू व तआला नोज यू इनसाइड आउट. आप लोग हमसे एडवाइसेस ले रहे हैं बिकॉज यू थिंक दैट वी नो बेटर और वेल एक्सपीरियंस्ड है, बट अल्लाह सुब्हानहू व तआला नोज योर सोशल बैकग्राउंड, योर ब्रॉट अप, योर फिजिकल कैपेबिलिटीज़, योर इमोशनल एंड्योरेंस. रेसिडेंसी में ये चीज़ें बहुत मैटर करते हैं. अगर आप आउट ऑफ स्टेट जा रहे हैं या फिर ऐसा ब्रांच ले लिया जिसमें आपकी फिजिकल कैपेबिलिटीज़ नहीं है, साइकेट्री जैसे पूछे, मतलब सुनने की आदत रहना, तो ये सब चीज़ें आपके अंदर है नहीं, आप खुद नहीं जानते. तो इट्स बेस्ट यू आस्क अल्लाह सुब्हानहू व तआला देन अदर्स. सेकंड इज नाउ यू आर फ्री. दिस 4 months which you got, you will probably never get in your life. So consult 3 doctors. One is resident doctor. First, that residency is made for you or not. Many people select a branch, later they'll regret it. बिकॉज रेसिडेंसी बर्दाश्त नहीं होती, या तो सीट छोड़ दे रहे हैं या तो सुसाइड कमिट कर रहे हैं. सो फर्स्ट गो एंड स्पीक टू द रेसिडेंट डॉक्टर विच एवर हॉस्पिटल यू वांट, हाउ इज रेसिडेंसी देयर. सेकंड, इमीडिएट पास आउट, वेदर सुपर स्पेशलिटी इज नीडेड और नॉट, वेदर यू कैन सर्वाइव विद वेदर इट्स एन एंड ब्रांच और नॉट. थर्ड इज a consultant. In my residency, I'll diagnose GBS, moya, or autoimmune hemolytic anemia. But after 40 years, will I do this, or it's just sardi da jalbu? So consultant, what you do as a resident are different things. So consult 3 things. And हमारे selections भी अजीब रहते हैं. I like incubation science anesthesia. मेरे को बच्चे पसंद है, pediatrics. तो ये criterias नहीं होते to select a branch. So consult these 3 people and go. And do night duties now. Whether in internship you'll get a fair enough idea, but few branches, anesthesia, psychiatry, 15 दिन में you won't get exposure. So जाओ वहाँ पे and do night duties there. And personal experience, all India is fair enough. Like they'll give you addresses of hospitals and you can easily select. But state will give you short form. Just now sir have showed KMHD/PEDS ऐसे देते हो लोग short form. You don't know what is KMHD. It personally happened with me. In filters I have ruled out, I have selected Hyderabad. So now only Hyderabad options are coming. My first priority was medicine, then pediatrics. So medicine Osmania, medicine NIMS, medicine Osmania, medicine Gandhi, medicine Kakatiya की जगह KMHD medicine I kept. Then Osmania pediatrics, whatever I kept. So this KMHD was Kamineni actually. So because I have entered the filter Hyderabad, Kakatiya was not showing. The only thing which saved me was GHMC ke bazu Secunderabad it's showing, Kakatiya ke bazu why not it's Warangal. I went and googled it. This KMHD was Kamineni actually. So before you select an option, Google it twice, thrice, how much ever time you want, but be sure that it's the college which you are opting for. And there are 3 terminologies. One is allotment, second is reporting, third is opt for upgradation. Online jo hota, you'll get an allotment. Allotment doesn't necessarily mean you got the seat. You have to go to the college and report it. There, physical verification of all your certificates will happen. And then you have to give an option whether you're willing for upgradation or not. If you're someone who want a branch, let's suppose you want pediatrics and you're a mid-ranker, 3,000, 4,000 ranker, you have an option of you can be aggressive, you can be neutral. For last rankers, you have to be aggressive, no other option. For medium rankers, first, in all India, be safe because 25,000 is a lot of money. So be safe in your option. This is for medium rankers, 3,000, 4,000 rankers. In state, you be aggressive. Put all the options you want, whatever you get to take.
Thank you. Jazakallah khair. I'm so sorry you cannot take further questions.
One thing I'd like to add is please don't take a branch as per the jobs what are there right now. Because recently I went for an interview for Osmania and there were 4 senior residency posts and there were 3 assistant professor posts and the applicants were 120 for orthopedics I'm talking. So the job is not the criteria for getting what you want. If you want jobs, you can take pre and paraclinical because it is more now in pre and paraclinical jobs. Simple thing.
One minute. The thing is,
we are very sorry.
no, because it's important. That's why I took this 1 or 2 minutes. The thing is, if you think that you have given 100% and then go for the seat this year only. Don't take any drop. If you think that you have not given the 100%, but the circumstances are not like that, then also you go for the seat. Don't drop out like that. I think, and one more thing. Everyone is telling about passion, but at the end, what happens? You have to take one seat because no other choice. So in that case, you should motivate yourself. See, life should be with life. That means you should motivate yourself to do that PG, that degree, that branch, that field. If you don't have motivation, then go to some people of that field and take motivation from there, take inspiration from them, and then go for the branch like that. You have to motivate yourself, or you have to take the help of others to motivate yourself. Then go for that branch. This is a good thing. Right thing.
Thank you. I mean, this is not the end. You can always come to us. We at DARE will definitely help you out. Anything you want to connect these speakers or other people as well. We are always there. I mean, we conduct these programs very regularly. I would like to thank Dr. Ubaid and Noor as well as Munif for giving their time. Jazakallah khair. Now we are having a very interesting and important sessions. We are having luminaries of different branches here. We have Dr. Syed Saifullah, my boss, radiology, interventional radiologist, very renowned interventional radiologist of Hyderabad. Dr. Abdul Khabir sir is not, doesn't need any introduction. He is state president of DARE as well as professor of ENT. And Dr. Majadil sir, Dr. Fahmida Bano, all are here. Over to Dr. Syed Murtaza sir, who is going to connect this panel.
Yeah, we have the mementos. I request Dr. Majid Adil sir to present mementos to Dr. Syed Noor. Jazakallah sir. Now I request Dr. Khalid sir to present memento to Syed Munib. Now we have next session for panel, navigating ethical dilemmas in modern medical practice. I request following panelists to please grace the stage. Dr. Mohammad Abdul Majid sir, MS DND Urology. Dr. Ahmed Abdul Khabir sir, Ahmed Abdul Khabir sir, MS ENT. Dr. Syed Safiullah, DNB Radio Diagnosis. And Dr. L. Fahmida Banu, DGO. Now I request Dr. Murtaza to please moderate the session.
Assalamu alaikum. I am Dr. Syed Murtaza Ahmed, surgical oncologist. I will be the moderator for this panel discussion on navigating ethical dilemmas in modern medical practice. None of the panelists need any introduction to you all. They are the luminaries of our medical field in Hyderabad. But briefly, I would still like to introduce them to you. Dr. Majid Adil sir is a superintendent Asra Hospital and is supposed to be the first few urologist in Hyderabad. He is a teacher of many teachers, in fact, and one of the senior most urologists, although he looks quite young, so don't go by his looks. We all know Dr. Ahmed Abdul Khabir sir. He happens to be state president of DARE. He is an ENT surgeon currently practicing at Kutpulapur Medical College. He worked as associate professor at Gandhi Medical College previously. He also happens to be TSMC co-op member. Then we have our senior intervention radiologist, Dr. Syed Safiullah sir, practicing at Red Hill Diagnostic Center in Nithya. Sir is one of the most sought after intervention radiologists. In oncology, if someone is not able to get a biopsy done from anywhere in the body, we send the patient to him and sir gives us a good biopsy result. We all know Fahmida Banu madam. Again, teachers of teachers. She is great at academics and happens to conduct regular CME at Famicare Hospital. She is an expert clinician as well as a very good human being. So, without wasting any further time, we are already running behind time. We'll start with the first question. So my first question is directed to Khabir sir. Most of the people here are future PG students. So one common issue we faced during our PG days was thesis preparation. We usually do copy paste from different theses and publish our results. So can you throw some light on this issue that PG students usually face and how to go about it?
Assalamu alaikum. The target audience here are those people who are getting up or getting ready to take admission into PG. And thesis is a very important part of curriculum. It is a research activity that a postgraduate does during his 3 years of duration. And unfortunately, this is not given the actual importance it has got. Previously, it was thought that the thesis was important. There used to be a section of questionnaire in their Viva host and all those things. But now it is not given importance at all. But this is a very integral and important thing. We are supposed to do an authentic and a correct research. We need to be very honest in presenting our results and statistics especially. We should not do that cut-paste type of thing. Unfortunately, what happens is, when we take admission in PG, it is the HOD who allots topics to the residents. This shouldn't be that. Because once we join our PG, we are given a time of around 2 months, and then university gives us a notification to submit our thesis topic. During this time, we are supposed to utilize it this time, talk to different professors, associates, and other people who are senior in this field. Try to take something which is very important. We do something sensible, something which is required, and we need to work honestly on that topic, get proper data, compile it honestly and then submit it. Then we can publish it in some of the journals. This is very important because if we don't do this honestly, then it becomes a cut, copy, paste type of thing. We'll be copying all the mistakes or all the things which a previous person has done. We are not supposed to do that because once we publish, these results might be utilized by some other person elsewhere in the world, and he can formulate certain regimens. He can formulate certain treatment plans based on that. So we cannot mislead this research which is going on. So we need to be very ethical, very honest in doing that. That is what I feel. So this is the first thing which we are supposed to do as a PG. So we need to be honest in that part right from the beginning. The other thing is whatever we learn in our PG, if we are honest in combining data, if we are honest, that is what is going to carry forward when we practice medicine throughout our life. So if we learn to tell a lie in the beginning itself, that will carry on, and that we will lose our credibility. That is what is happening. When we try to publish any paper in international journals, if it comes from India, they suspect it. They keep it aside. They don't give that value. So what we need to do is we need to build our credibility right from the beginning. And suppose if it is from India also, we submit it to some international journal. They also study the track record of that author. They see how honest this person was. What are his contributions in research? And suppose if Indian papers are not given credibility or value, we can build up our individual and self-credibility by giving very good research matter and material. We can publish in very good authentic journals, and that is how we get recognition, and that is what we have to stick to. So that we contribute in a positive way, we can be a content producer to the future research and so on. This is what I personally feel. Thank you.
Other panelists are also requested if they want to add anything, although I'm directing my questions to individuals, but if anything needs to be added, they are most welcome to.
Assalamu alaikum. Thank you so much for the introduction. Presently, I'm the vice principal there. I am not in Nasra Hospital and just wanted a small correction.
Okay, my apologies.
No problem. Yeah. So, why I'm saying this is that I go through the thesis and I'm involved a little bit in that, not completely because other things to do as well as my surgeries. So, what Dr. Kabir said, I'm totally with that. Just 1-2 things I want to re-emphasize. Take this as your first opportunity to present papers later in life. And you have 3 years. Talk to the HOD, surgical sites, to know what they do more there. And accordingly, you organize your thesis so that, when you do it, it's all genuine. Let it be less cases, let it be what it should be genuine. And all papers, all theses are a type of presenting it's a storytelling which is done in a different way. So have your own way of telling a story which you have experienced. And nowadays, for your information, a logbook is mandatory, what Dr. Kabir was already saying. So we all have our logbooks. I know all who have done PGs know that we have a logbook here in life, where you remember your boss, what he did as a surgeon, and then you follow that. Your boss, what he wrote as a prescription for a particular symptom, and you follow that. But nowadays, logbooks are mandatory. So document whatever you have. It's online also, as well as you have to maintain a logbook. All PGs nowadays, it's mandatory from NMC. So do that and be honest with your thesis. That's what I totally agree with them. Thank you.
Assalamu alaikum. Thank you, Dave, and all the teammates, especially Osama, for giving me this opportunity to meet the young friends. My contribution to today's thesis is a wonderful opportunity to have a flair of the research. You will start reading more about the subject. In this process, you will learn how to do literature search. In this process, you will get innovative ideas. And it is not only to just the MS or MD degree for your PG, it is going to give a credit for your career. Don't depend completely on your seniors or HOD to give a topic. Nowadays, Karlo Dunya Mukhi mein, so knowledge is in your hand. You need not go to library. Everything is in your cell. Utilize your PG time in a most proper way. You search the what is latest, what is feasible, what is practical. You put your thought process to an HOD and give the importance. Madam, you select the topic, then they will definitely get you. Start from day one, be innovative and complete the thesis as if you are doing a research. It will give value throughout your career. This is what I wanted to say. No way I accept for cut and paste. We have DNB seats every year, I get 2 DNB seats. All my DNB candidates at first attempt they are passing. I think you people are counseling for MS and you didn't mention about DNB.
DNB it was mentioned.
It was there.
Yeah.
Okay, right. Thank you.
Then another common issue or scenario we find in our PG days, and so even they might find, they are overworked and understaffed. So many a times while writing the blood pressure of patients or while reporting urine reports by the pathology PGs or CBC reports, they will just write normal. We used to see it commonly during our PG days. So with regards to that, Adil sir, madam, any thoughts? How will you counsel the upcoming?
You see, we forget the common factor, fatigability. In fact, doctors are overworked. They work for 36 hours, sometimes without hours, without proper food. It is very unfortunate. I have seen in many colleges there are no proper toilets as well. So I think these things should be rectified. No way you can make them work like any inhuman. And more and above, the peer pressure, the professor's pressure, very hostile type of environment, this unfortunate postgraduate time, they carry these traumatizing memories. There are only 2 ways. I suffered, I will make my PG suffer. Or else, I suffered enough, I won't make my PG suffer. But that stage is later on when you become teacher. But when you as a student, I agree with you, there is a lot of suffering. Something we should do at a war front to minimize their suffering, to give them comfort.
The question was like, what's going on is right or wrong. First of all, overwork is something which is wrong, which has been accepted. It published in journals also that overwork of any human being is wrong because it won't fetch the results. But the whole problem is not just here, even in other countries, Western countries, the postgraduates, all of us have faced this. Postgraduates have to work a lot more harder than others. Let's accept that fact. But what we like for internship, sometimes they used to come to me for saying if we have to do too many duties because there are few interns. So I very strongly made a rule that only 4 duties for interns. Otherwise, whatever happens, you can't have a person working 15 days a month, 24/7. It's not humanly possible. So, like what Madam said, totally agree that it has to come down. But what I am trying to say is, as the things go there, try to, the first year, just make sure that first year you have to put in a little bit more extra effort. That is there, it's a fact. And you have to help your third year seniors. And then as you go to second year, it will be probably lesser. So at least structure it that way so that, every year then you have to read up, you have to do other things. So first year you take maximum responsibility of work, groundwork, so that you can learn more of the practical aspects. Then the reading part starts and all that. Of course, you read every day. So definitely I say overworking, not recommended, but a way out has to be found, probably by keeping more DMOs in hospitals which have, a less number of PGs in departments. I should not be recommending things like this, but that's the reality of life. We should have a this kind of balance, and I agree with that. Otherwise, we tend to make mistakes.
Yeah. So, next question for Shafi sir. You run a diagnostic center. Many times you might be in a situation where the clinicians advise some investigations or some procedures which you might think is not in the good of the patient. But the patient tells you that please do not release these kind of reports which needs to be released for public health importance or medical legal purposes. So how do you deal with such scenarios?
Assalamu alaikum everyone. Thanks dear for inviting me here, and thank you Dr. Murtaza for the kind words. Jazakallah.
So sometimes we get referrals for particular procedures, and there are two kinds of things actually. One are procedures which the consultant refers for in good faith. There's a liver lesion and somebody has diagnosed it as being some cancer or something neoplastic, and you find out that it's not and it's a benign lesion. You just call up the consultant and convey politely and firmly that this particular lesion does not require an intervention, and you can just safely observe it. And that's one way. If certain people if they refer a patient and they want the procedure to be done and it's not required, we firmly and politely tell that we would not like to go ahead with it. Now, there are certain times when we used to have an ethical dilemma with fetal reduction. We used to get for example, there's a lady with a small habitus. Personally, had a case where my neighborhood pharmacy guy, his wife conceived triplets, and she had a small habitus, and she was advised for reduction. I didn't entertain, and she went on to deliver the triplets. One was a 1,000 grammer, another was an 800 grammer, another was a 600 grammer. The 600 grammer passed away in a couple of days. Another one survived for 2 months, and she lost the third one also. So then I was thinking back, whether I should have. What do you think, ma'am? What do you think? It's a very important thing because, see, in cases like monochorionic diamniotic pregnancies where you have TRAP or a cardiac twin and all that, selective fetal reduction is known to benefit the pregnancy. It's a no-brainer. You have to do it. But in such cases where you have a triplet gestation, and somebody says that this lady will not be able to in that there is also one aspect is the financial aspect. If you have a 1,000 grammer, 800 grammer, 600 grammer, they would have to be in the NICU for a very long time, and the consequent financial consequences. But however, I used to think that it's a major ethical dilemma. Who am I to take a life? It's a simple job. It's a 1 minute procedure. Just take a needle, stick it into the fetal cardiac, and inject 1 cc of KCl, and that's it. You have asystole. But madam, what do you suggest? What do you?
You are really hit the bullseye. It is the most difficult ethical dilemma. There are two things. One as a doctor, second as a Muslim. See, in my hospital, we don't do terminations of pregnancies. It is permitted in the law. It is permitted in this society. Everybody asks, but we have made a decision. Being a Muslim, we won't do termination of pregnancy, whatever may be the cause. Suppose somebody has pulmonary hypertension or fatal disease, we just get so may do that also if it is a definitely fatal condition for the mother, but we don't do. His question is very, very critical. If it is a triplet pregnancy, first of all, why triplet pregnancy happens? I worked sometime in abroad. There were triplet pregnancies which are happening naturally. All the triplets continued. No doubt they will get into preterm labor. The facilities made the baby survive. And we used to get surprisingly Sudanese patient, triplets very common, reasonably good weight they used to get, and the mother used to feed all the 3 babies. It is a wonderful thing to see breastfeeding 3 babies. But whereas here, the triplets or quadruplets are happening because of irrational use of induction of ovulation drugs, irrational of putting the embryo transfers. You have to first cut down those unethical things, then these dilemmas will not come. Whatever may be the outcome, they are destined to die, but thinking that you will make 2 fetuses survive, you cannot kill one potential human being. This is my personal way.
Thank you very much. So another thing is, sometimes you get referral for example, I had a young girl, in her 10th, she was having her final exams, and she was referred with ascites, and so they asked us to tap the ascites, so looking like cocks. So when I did the scan, she also had other things like mental thickening. She had peritoneal nodules. She had bilateral hydrosalpinge, myosalpinge. So I told them this is this looks like cocks. Many a times fluid aspiration may come out inconclusive, and you're know better at the end of the procedure. So it's better that we do an omental biopsy or a biopsy from one of the peritoneal nodules. And then what happened? Because what happened is that was diagnosed by me just at that time. And the referring clinician knew just a diagnosis of a ascites. So the attendants who had come with the patient, they were like, Dr. Saab jo likhe aap wahi karo. I went ahead, did the ascites, it was inconclusive, there was no raised ADA or anything like that. So, they came back again, and this time, because I had given an ultrasound report, the doctor said to do an omental biopsy. And then the attendants were like, why didn't you do it before? You should have done the omental biopsy before, why did you do? I said, I explained. So the problem is, one attendant who came on the day when I did the ascitic lab was not there. Another day, the next attendant came. So this is also very important. You have all the attendants in place, whoever are going to be responsible for the care of that particular patient. Because it so happened, I used to work in an oncology center, and there was a young child with an osteosarcoma. And the attendants were there, they had given consent for an amputation. Amputation was done. Subsequently, another attendant came and raised a huge ruckus. How can you amputate the limb of a child? Because he didn't understand the consequences, what would happen if you leave it like that. So, you need to really, communicate with those people. You need to communicate on a regular basis with the referring clinician what is going on, whether a particular procedure needs to be done or not. And another very important thing is consent. Without consent, don't do any procedure. Okay, there was a gastroenterologist in Kolkata who was slapped with a fine of a few crores just because he didn't take consent for a upper GI endoscopy for a 90-year-old gentleman. Now imagine, obviously nobody can, shove a scope through a 90-year-old patient just like that without his consent. But there was no documentation. So documentation is very important, very, very important. Okay, there was one young girl who had come with some swelling in the left submandibular region. And the doctor had written ultrasound neck plus or minus FNAC. I did the scan. Submandibular, there was just a reactive node, which is not something very significant, but she had a left thyroid nodule, which looked like a papillary cancer. So I went ahead, I did the FNAC from the thyroid nodule, and sure enough, it came out papillary carcinoma. And then the attendants came and they fought with me. My girl came for a swelling over here, and you did FNAC from here. What business did you have? They fought with me. My mistake was that I didn't take consent. I didn't explain to them. I just did off the FNAC. That's my mistake. I should have conveyed to them that what is over here is of no consequence. They said, मेरी बेटी को कोई problem ही नहीं है, तुम बोल रहे हैं cancer है, कैसा है? So anyway, they made a hangama in the diagnostic center. I had to pacify them and everything. And then, that's not the end of the story. That they had the temerity to come back the next day and ask for slides. भाई अगर गलत है तो कहीं को आया आप मेरे पास कहीं और जाओ. The thing is, see, you feel frustrated. You did something very good for the girl. You did the right thing for the girl.
Have you taken consent to give the slides?
So the thing is, मैं बोला ठीक है भाई दे दो सुझाने दो. Yeah, poor family है, वो कैंसर बढ़ने के बाद जो है. So these things, see, you do very good things for the patient, but nobody is for you. Have to do all the documentation. You have to take consent. All these things are very important. आप बहुत अच्छा करके भी जो है, then you land in a soup like this. Not good for you at the end of the day. Thank you.
One more point to add. Earlier, 39, 40 years ago, we used to just take verbal consent. She's not progressing, we'll take up her section. Or she's progressing, but let me try and force it. With a good faith, she may deliver normally. Gone those days. Last 2 decades, from single or double digit cases to 53,000 cases has been filed against the doctors as medical negligence. So medical legally, even with a good faith, you cannot do what you are not having in the consent. There is a very famous case in the medical legal issue in the gynae. The patient is 40 plus years. One of the corporate hospitals, she's a very well-known gynecologist. She did the surgery. It was endometriosis case. With a good faith, this is grade 4. She removed one ovary. The consent taken was cystectomy. What she did was complete removal of the ovary because it was of no use and no healthy tissue. The fiancé of the patient, she's 40 plus. He said, you removed my fiancé's ovary and he has filed for crores of rupees. The case is still going on. How much frustration for the doctor? She did a good faith. Her pain is relieved. Quality of life of the patient is improved, but the case is going on. So don't do, even if you have a good faith, definitely no doctor will do harm. Will anybody try to do harm to the patient? No. But unless it is written and taken in proper consent. In fact, nowadays it is a video room, video consultation with the patient and attendants. Unless it is a very unfortunate scenario, but we have no option. You don't do which you have not taken consent. Even in emergency situation, suppose the patient is under anesthesia, she is bleeding. The situation is you are not able to control the rate PPH. You have to remove the uterus of the patient to save their life. Just cannot proceed with hysterectomy. You have to go outside, talk to the patient, husband, family, and take the consent, then only you proceed. This is very, very important. Medical legal issues is too much, so I will stop here, otherwise it will become another topic.
Taking this issue of consent a bit further, madam, sometimes we don't have enough time to convince the patient's attenders about the urgency of the treatment or intervention that is needed. So how do you deal with these scenarios in your practice? Like you said, bleeding is there or something like that, where hysterectomy is needed, emergency. You can't wait to convince the patient's attenders.
See, the best example for this was abroad. The woman will agree to remove any other organ but not the uterus. It was a very, very critical situation. The woman is bleeding. Neither she agreed even once she required, not husband or relatives. So, in the process of conserving the uterus, intraoperative time was exceeding 4 hours, 5 hours, but the supportive system was excellent. We were getting unlimited blood, 50 units, 60 units of blood, 50 plus units of platelets, hematologist is here, senior post anesthetists were there. In the process of saving the uterus, unnecessary morbidity has tremendously increased. Then I analyzed in that university how many cases I was involved in one case, and actually it was accidental entry of my entry into the surgery because I wanted to save my colleague who is from Chennai. She became so nervous, she was not able to do. She asked my help. When I was scrubbing and going, the other Nigerian colleague said, don't go, you will be involved here. If you get involved, your passport will be seized. For a minute I got worried, but then I said, on humanitarian ground, I have to go. She was senior lady, senior to me. I said, just don't worry, I will do. I started with the procedure. And nobody was coming for rescue. No consultant was giving the consent. Then I took a decision, I said, announce code blue. The anesthetist said, I cannot take the responsible code blue because there is no cardiac issue. I said, I take the responsibility, you announce the code blue, we announce the code blue. Because code blue was announced, many consultants came. Code blue in the OT clinic came. Then I said, so many consultants are there, now you take a decision. Otherwise, we are going to lose our table. Luckily, that common sense has helped. Nobody later on question you why you called for code blue. Because unnecessary, if you give a code blue also, will be questionable. But luckily, that has helped to save the patient life. So, if such a situation is there, as Murtaza has rightly said, 2 surgeons or 1 surgeon or anesthetist can sign because to save the life of the patient, we are going ahead and you can go ahead.
Another scenario we often come across these days is a patient will be hopping around different hospitals. They'll be advised some surgical procedure and they'll be willing to get it done. Then they come and meet us and request us to remove the uterus or remove the kidney or that kind of thing. So in case we think that it's not needed, so how do we explain it to the patient? How do we go about it? The other spectrum of this is patient is not interested in getting the procedure done, but we think that he needs or he or she needs that procedure. So how to take care of this dilemma?
Your question was answered in a small way in the previous answers. Where the doctor has to take the decision for the patient is only when it's life-threatening. Keep this in mind. Initially, we had a time when, surgeons used to open the abdomen, do exploratory laparotomy was one word.
Yeah.
Open the abdomen, see, oh, there's nothing, close, and come out and say, there's nothing. So patient will be like, Doctor Saab bol de kuch nahi hai, shukriya. Pet khol ke band kare baad, shukriya. For no reason. That was 30 years back probably. Now you cannot even dream of doing that. So that's the difference now. So you are not supposed to enforce your thought on the patient. Enforce your thought on the patient. We are supposed to counsel. We are supposed to advise them. Give them professional advice. They are supposed to decide. And regarding previous question, which fits into this, see, so many people come and give different opinions when you're about to perform a surgery or something. The patient's spouse, parents, and children. You tell them very clearly, these are the persons who are going to take the final decision, and it is their decision which is going to be followed. Not Mamo, Bhanje, or somebody coming and saying things. Because it doesn't work like that. The children have to be there. Even if they are abroad, talk to them on the phone. We have a duty to counsel them. Don't take the decision personally by yourself. Talk to your brothers, sisters about your parents, and then come back to me. And when they say that, I've spoken to everybody, I write it down even in my OP file saying, discussed with all his family members. So this is how we save ourselves and the patient also, and the attender who's coming with the patient. So when these decisions come, if somebody says it need to be removed, I feel it may not be removed, or I also feel it is removed, and a patient says no, don't remove, just write the patient to that. Why so and so, patient unwilling, so this procedure is going on in spite of counseling. I think it is very important to be safe and be very truthful and honest with the patient. So no forcing the patient for any procedure except life-threatening procedures. That's the dictum we have to follow. We've learned through all these years.
Even if it is not life-threatening, what Dr. Saab said is very true, very correct in life-threatening procedure. Suppose you asked removal of uterus. She has a fibroid. She is perimenopausal, postmenopausal. She is asymptomatic. You personally think there is no need. Never get tempted to say, "Okay, हम नहीं करे तो दूसरे करते हैं, करने दो." One good thing is Allah Subhanahu wa Taala will ask what we did. He won't ask why other gynecologists did. It is her take. You do what as per your consciousness. You critically decide. If she needs, you go ahead and do. If she doesn't, you just say there is no need of surgery. Suppose she will come back after 3 months and say you didn't remove, she removed. Okay, good. That was a good decision. Never criticize another gynecologist also. You just say, I thought it is right. If she thought it is right, she may also right. You are staying in the glass house. Never throw stones on others. Never. You just say, the decision was mine. It was her decision. You have the option to follow whomever you want. Don't get tempted. Okay, you will have less. Let it be. Razat is Allah. Don't worry. But don't do which your consciousness doesn't permit.
So nowadays, with commercialization of the medical practice, there is a trust deficit between the patient and doctors. They see doctors with a lot of suspicion. All of you are very trusted doctors in the community with years and years of practice, ethical practice. So as concluding remarks, I would request all of you all to give any pointers to the young doctors how to build that trust between patient and doctors. At the same time, most of the people here will be doing PG training from now. During the PG training, they'll be frustrated, tired, so that gets translated into harsh behavior towards the patients and all. So how to avoid that? Any pointers, any advice? I will request all of you to give your opinions and wrap the meeting.
So most of the time PGs are overburdened. They are stressed out. So what they try to do is, one more thing is they are not responsible even for their behavior. They don't have any CCA rules like government employees or professors or whatever. So they just try to, someone has scolded them, they try to remove and their frustration on patients. This is what I have seen in government setup at least. So as this is a common thing, but we need to think and we need to retrospect our behavior. So when we are a doctor, we need to be very kind enough.
we need to be, we need to at least talk in a polite way, in a mannerful way. We need to be soft with the patient. That is the basic human etiquette. With being in a profession where we are supposed to, treat patient, we cannot be harsh. See, we might give some medicine that might cure the patient, but the harsh words that we talk might be remembered by the patient afterwards also. So let us not be very harsh. See, a patient, basic etiquette, they shouldn't be lacking from doctor. So this is what we need to do, one thing. Second thing is, see, it is Allah who gives treatment and cure. But a kind word, even if the patient is not relieved of his trouble, he will not blame you. But if you are harsh, even if your treatment cures him, he will blame you for your behavior. So we are responsible for the behavior. And of course, we are answerable in front of Allah subhanahu wa ta'ala. So we need to be very cautious when we are dealing with the patient. See, there is a hadith Qudsi also. On the day of judgment, Allah subhanahu wa ta'ala asks a person, see, suppose you had visited I was sick and you did not visit me. Then a person says, how can you be sick, Almighty Allah? Then he says, so and so was sick. Had you been to him, had you helped him, had you given a kind advice, you would have found me there. So what we are dealing with has got some importance, religious point of view also. So we need to be soft. We need to be talk to the patient in a mannerful way. How much ever frustrated we are, how much ever exhausted we are, so that we at least fulfill that humanity and the human etiquette. So that is what is going to help us. First and foremost thing is in pleasing Allah subhanahu wa ta'ala. Secondly, we will be fulfilling our professional demand. And thirdly, probably we will be getting good name if we are very kind to the patient. This is what I feel. And if we are very kind enough, that is what is going to strengthen patient-doctor relationship. That is going to build up trust between doctor and a patient. That is what we can at least do. And following that, we can follow etiquettes. We should not exploit patient. We need to investigate to the extent required. We have to always be scientifically and subject-wise, we have to be correct in taking decisions. We need to advise correct treatment to the patient. All this credibility and everything comes over time. Suppose there is a patient who doesn't trust anyone. If he has to trust you, you should have a good name in the society. Only then he will come for an opinion from you. So this is built up over years. This cannot come overnight. So we need to be very true to Allah, true to ourselves, true to our profession, and true to the patient. That will build up our credibility, and that is how we can strengthen the patient-doctor relationship, and that will help us to be successful in this world and the hereafter. That is what I personally feel.
Very good questions. It may take just a couple of minutes more. One thing is the second question which you said was
harshly speaking.
Harshly speaking. Believe me, very easy to say don't speak harshly, but it becomes so difficult as you grow older, as you see more patients. The repeat questions which come to you for years and years together, and you keep on answering till your throat is dry, makes you really, really irritable. It's not easy to say don't get irritable. I used to see my seniors means my professors who used to be a little chilchada, as we call it. Acha lagta hai ki I'm becoming like that now. But whenever I feel I'm becoming like this, like what Dr. Sabir said, I think, I shouldn't talk to them properly. I go to the next room, I recite something, Quran se ek ayat pad leta hu, I just keep quiet for some time, come back and try to talk to them very politely, but very, very difficult to keep your cool after long years of practice, after long hours of work for a PG, but we have to do it. That is one thing. Second thing is, nowadays we have, the first question was the patient, trust deficits. It is so high, you can't even believe. The moment you start writing prescription, they'll look at you suspiciously. The moment you start writing an investigation, the next question is, zaruri hai kya? I mean, zaruri hai, nahi hai, these questions are very difficult to answer. Probably it's not zaruri, but you think it is zaruri for the patient, and that's what you've written. The next doctor, the consultant number 2 may say, no, this was not required, why did you get it done? So let's be truthful to ourselves, thinking the person sitting across is our relative. your parent, your uncle, whoever, would I have done the same thing to my relative? If I'm doing the same thing to this person or advising the same advice to this person, then I'm right. जरूरी नहीं होगा, जरूरी होगा, that's a different thing. मैं बोलता हूँ आपको आना भी तो जरूरी नहीं था, but आप आए, बैठे, बात करें. If you take it to the next level, सांस लेना भी जरूरी नहीं है, but if you want to live, you have to breathe. That's what life is. I mean, let's be very honest about it. So the suspicion is at extreme level. One example I'll quote. Recently, one patient came. PSA was some 40, 50 something. Lesion in the lung, query lesion in the bone, one lesion in the liver. So I said, the doctor had come with the patient. Patient is some 70 odd. I said, maybe carcinoma, but we'll do a biopsy. Not willing for biopsy. I said, if you don't want to get a biopsy done, then you get a PSMA PET CT scan, which is a little bit expensive investigation. She said, okay. They went, came back with the son from California. So they had to wait for a little time more in the OPD. This person got frustrated. So he just sat there and just wrote on my profile. I don't care. I don't even see those profile feedbacks and all. I don't employ anybody to give them good feedbacks. But he said, now people must have realized that this doctor is working for money. And he has written one test unnecessarily. And now there is no malignancy in it. He wrote so that he makes something he wrote. And immediately it reflected on my phone. And my boy came and said, somebody's written this. That man is sitting outside. First time he's coming, not even consulted me, and he gives me a bad this thing for, he doesn't even know me. I went and told him, what have you written? And mind you, you can't remove those, this one for life. कोई खूनी भी रहा तो उसको एक उम्र कैद की सजा होती, एटलीस्ट 14 साल के बाद बाहर आ जाता, ये मरे तक साथ रहता. So you are condemned by a patient who sat there not knowing what you have done. Then his brother came. I said, all of you just get out of here. I don't want you. No, sorry, sahab, hum 10 baar aaye, 20 baar aaye. But look at the level of suspicion. That man just drops in from California. He thinks he's the top guy because he's from US, and he just drops a comment and walks out. I shouted at him. That's a different story. But finally, it was removed, probably. But that's how it is. So the trust deficit is very bad. From our side, I don't believe in writing less investigations in courts. If you feel it is important, you have to write. And if the patient says no, you should say patient not affording, that's why it may not be done. Because कल के दिन आके बोलते हम तो आए थे, आप क्यों नहीं कराए? आप बोलना था, एटलीस्ट आप बोलना था, हमारी मर्जी हम पैसे कैसे भी लाते थे. So it is your duty to advise. Once you advise, if they don't do it, it's fine. I tell them this, आप कराइए नहीं कराइए वो आपकी जिम्मेदारी है. बट आप मेरे पास आए, बैठे, पैसे खर्च करे, मेरी जिम्मेदारी तो मैं निभा देता हूँ. मेरा फर्ज है आपको बोलना, आपका हक है नहीं कराना. So let's be very clear about this. We have to tell them what is good for them. कुछ कितनी भी बदनामी हो, आपको CT scan लिखना है तो लिखना ही. It may be 3,000, it may be 1 rupee, it may be 20,000. उसके बाद में be true to yourself. उसके बाद में वो नहीं करा तो अलग बात है. So trust building is very important. Don't trust patients कि अच्छी आप खुदा के बाद आप है तो वो तुम्हें believe ही करना छोड़ दिया, because it doesn't make sense at all. Next day it will be like slapping you. So वो आप है, ये है, वो है, वो secondary है. Be very honest about it. I'm a professional. I'm advising you. Whatever it is there. I'm being truthful. So be very specific and be very straight and keep things in writing.
Hats off to you, Dr. Adil. You have just briefly have told what is the current scenario. I really admire the way you have put it. You will not believe the same patient yesterday they were telling and praising you, today they are coming and fighting. Unfortunately, you people have not seen these golden days what we all enjoyed. They used to touch our feet, they used to put their names for their children. Those are golden days. The only remedy is sit in a time machine, go back. This is not possible. So the only thing is what we got, you can also achieve, but it is a long way. Persistence, perseverance, and patience. Patients are not having patience. Doctors should have patience. As I said, चिड़चिड़े हम भी होने लगे. I tell my daughter-in-law, I think it is very postmenopausal चिड़चिड़ापन आ गया. You take over. That is the best thing. Hand out that case to your assistant or your postgraduates and just go and have a cup of tea and come back. Because you can't hide your feelings because you are a human being. Instead of shouting at them, instead of getting irritated with them, just be seated, hand over the case, you cool down yourself, do self-hypnosis and come back. But shouting at the patient and showing your dominance, nowadays patients are not accepting.
Just one word. For procedures, I want to say this. Counsel, spend more time. We have to understand this because they're very worried about what you're going to do to them. For procedures, you have to counsel repeatedly. That is one thing you have to do. If they ask questions repeatedly, you have to answer them repeatedly. If you want to take a fresh consultation, earn your money, but spend time with them. That is very important. Nowadays, they don't have time. Jaldi bhagane jate, they don't get what you're going to tell, you want to tell them, and then procedure ke baad, we have major repercussions of that. So for procedures, any procedure, whatever, take a lot of time, even if they're asking questions, and use that.
And like Adil bhai said, no procedure is simple. Even a simple local anesthetic injection can result in a vasovagal and you have patients collapsing. So procedures always counsel. Now, like when we do a lung biopsy, we tell the patient that there's a chance of a pneumothorax. Most of the time they're self-limiting. Once in a while you need to put in a chest tube, we'll send you with home. If you don't tell the patient and afterwards you land up with a pneumothorax and afterwards you tell them, tube dalna padta, uske itne paise hote, aisa hota, then they'll say you never told us. And many a times you have patients with hemoptysis post a lung biopsy. And if you don't tell the patient, they are shocked. They are shocked to see blood when they are coughing out. But if you have already told them, देखो भाई आप जब हम लोग procedure खत्म करेंगे, there's every chance. Even during the procedure, when you cough out, you may cough out blood. They are prepared for it because you have told them already. But if you have not told them, they are shocked, absolutely shocked. And
Dr. Shafi is one of the fastest intervention radiologists I have seen. I think your time to do the procedure will take fraction of a minute. And whereas your counseling has to be a little long, isn't it?
Yes,
you are spending more time in counseling than doing the procedure.
Yes. Thank you for the kind word. And also talking to patients, actually, if you are honest with the patient, I remember there's one senior radiologist in Bombay, Bhavin Jankaria. His father was G.R. Jankaria, one of the father of Indian radiologists. So he has got a very big center over there, and they do very high volume cases. They have the best machines, state of the art, everything. So in his center, there was a lady with metastatic breast cancer, and she was on follow-up, and they missed a liver lesion. Subtle liver lesions were there, which one of his colleagues was reporting the CT. He missed it on triple phase CT. And the patient, they slapped a court case of a few crores. And then Bhavin Jankaria requested the lady to come. He talked with her very nicely, apologized that we missed, we know what you have gone through, everything. And he talked very nicely, was very honest with her and everything. And subsequently, she took back the case. What I mean to say is, see, many a times patients get upset with you because you didn't even talk to the patient. अरे बात भी नहीं करा भाई मेरे से, बात भी नहीं करा, बात तो करना था, बात भी नहीं करा, इतना बड़ा है ने, मैं देख लेता हूँ. So they get into that revenge mode. Talk with the patient, take time out. So you're seeing a patient is paying you for it. He has every right to be heard. When कितने भी सवाल हम पूछा, you have to hear it. The other day there was a patient for a prostate biopsy. He asked me so many questions. I mean, I'm younger than Adil bhai, but I got frustrated. He was like, कितनी देर लगती? I was like 20 minutes. इतनी देर कहीं को लगती? I was like, patient को prepare करना पड़ता, उसको anesthesia देना पड़ता, लोग pain killer देना पड़ता, antibiotic देना पड़ता. इतनी देर लगती? मैं बोला ठीक है, आपको 5 मिनट में कर देता हूँ, anesthesia, pain killer और सब कुछ मिनट. नहीं डॉक्टर साहब. So the thing is, patients are getting on your nerves. You have to be really patient. Like Adil bhai said, have a cup of water. Relax for some time, then again go back to the patient. Patients are becoming very difficult. I also get requests sometimes to change reports. Sometimes it's not so difficult. Many times patients who want to go abroad, they get anything in the report. See, Saudi has so many applicants for jobs, and they don't mind. The slightest of things, they'll reject visas. They reject visas. Medical rejected. So if there is a person with, maybe a CT scan which showing some minor, fibrotic strand or something like that, what we usually do is, okay, okay, we'll not mention, we'll just mention no active parenchymal disease. Okay, so that means, okay, usko wo pass raha tha. But, major reports, you have sometimes teenage pregnancies and all that. The parents come or somebody comes, they tell you to change the reports. I tell them firmly and politely, I'm sorry, I cannot do that. This report stays the way it is because it has got medical consequences, isn't it? You just can't change that report. You can't change that report. It can have serious medical, consequences for you. So we have to be really patient with the patients these days. And
here one trickiest thing is the patient nowadays, the young girls, the type of patients we do get, they will say, don't tell to my parents. What is the call? The report shows yes, 6 weeks, 8 weeks pregnancy, and she says, my mother is sitting outside, don't tell. What will you do?
I'm going to tell them, ma'am, I had a call once at 2 o'clock in the morning, severe collapse, young 18-year-old girl collapsed. She had a ruptured ectopic gestation. She's in the throes of, she's collapsing actually. You have to tell her, you cannot.
My question is,
I know, you have to tell.
Life-threatening.
Yeah.
But if there's a 18-year or 21-year plus, then you have to respect their wish. You can't do much about it.
Emergency, yes, you have no choice. But if the patient is not in emergency, you can't even tell to her mother or father. You have to respect the patient's confidentiality.
Because she's now an adult.
She's an adult.
Legally speaking, for adult patients, you have to respect the privacy. Because a lot of times I get infertilities, azoospermia, so that man probably will not become a father forever, most likely. And they tell me you don't inform it to my parents or whatever. I have to respect the privacy. So if
he says don't inform my wife,
that's a different thing. I give them time. But the wives are smart enough, good. I mean, I'm happy with that because they want to take other opinions also.
women are smart.
Yeah, of course. And women should be smart in these things. I understand that. And they should go. But usually the wives get to know and they inform. I tell them to take the decision as a couple, of course. But you have to respect their and honor their privacy and their right to not, share their khamia or whatever the shortcomings with others. As a doctor, we have to do that, I think. I mean, it's open to audience, but I think medical legally we have to respect them.
Thank you. There's a lot of change in the culture of the society. The girl comes and says, do a pregnancy. We will be thinking, maybe you are having exam, that is a stress, don't worry. She said, I am not having the stress exam. I think I am pregnant. Right when ultrasound. This sort of patients we are getting. Still, we have no right to inform the parents or whoever it is. You have to tell. But as Shafi has said rightly, you cannot change the report. If beta HCG is positive. Scanning, it is showing a fetus, yes, it is a fetus. Never change the report, but don't inform the parent, but write down in the document, patient is insisting, doesn't want to tell anybody, and take her signature and keep a Xerox copy with you. Tomorrow her mother or father will come and why didn't you tell? We trusted you, doctor. You are a family doctor for 20 years. You said, your daughter said not to tell. I have no right to tell.
Thank you for this engrossing and enlightening discussion. For lack of time, we need to wrap things up now. I will hand over the mic to my colleague for taking the discussion further.
Thank you, sir. Now we have mementos. I request Dr. Tahir Mehmood sir to present a memento to Muhammad Markaz.
Before we conclude, we thank the wonderful moderation you did, Dr. Murtaza.
Yeah.
Thank you so much.
Markaz, sir.
Thank you.
Now I request Dr. Syed Imran Ali to present a memento to Ahmed Abdul Khabir sir. Now I request Usama to present memento to Syed Safiullah sir. Yeah, now I request Dr. Aisha Noman to present memento to F. Abhinav Banu ma'am. Coming to the conclusion of this session, I request Dr. Atif Rahman sir to please give the concluding remarks.
Assalamu alaikum warahmatullahi wabarakatuh. Alhamdulillah, we are able to do this PG admission guidance. Inshallah, all students who attended will be benefited by the efforts of the DARE. I, on behalf of the DARE, thank all the speakers, panelists, and students for making this PG guidance program a great success. And DARE is a platform for the professionals to learn, unlearn, and relearn. So, as we are all seniors guiding the juniors, but also we are learning in this process how to make the things, what are the mistakes we have done, we have to unlearn and also relearn the things with the present situations. And the learning is to be the best version of yourself, which benefits you, family, and the society. So we need virtuous people, institutes with high moral values and ethics, who are directly or indirectly influence us to be a best version of ourselves. DARE with mission, making efforts. I, on behalf of DARE, request you to join and take the mission forwards. Thank you all. Jazakallah khair.
Jazakallah Atif sir for the kind words. Now I request Dr. Noman to please complete this session with a dua.
بسم الله الرحمن الرحيم الحمد لله رب العالمين اللهم صل على سيدنا محمد وعلى ال سيدنا محمد وبارك وسلم ربنا اتنا في الدنيا حسنه وفي الاخره حسنه وقنا عذاب النار وادخلنا الجنه مع الابرار يا عزيز يا غفار يا رب العالمين ربنا افرغ علينا صبرا وثبت اقدامنا وانصرنا على القوم الكافرين سبحان الله وبحمده سبحانك اللهم وبحمدك نشهد ان لا اله الا انت نستغفرك ونتوب اليك या अल्लाह हमारे सारे गुनाहों को माफ़ फरमा हमारी बख्शिश फरमा हमारी सय्यात को हसनात में मुबद्दल फरमा जन्नतुल फिरदौस में आला मुकाम अता फरमा अम्बिया मुरसलीन सिद्दीकीन शुहदा सालिहीन की जगह अता फरमा या अल्लाह यहाँ जो कोशिश की गई है इसको शर्फ़ क़बूलियत अता फरमा और जिन जिन लोगों ने भी इसमें हिस्सा लिया है उन सारे लोगों को सब बेहतरीन अजर और नीमुल बद दुनिया आखिरत में अता फरमा और जो लोग यहाँ पर PG नीट में क्वालिफाई किए हैं और जो लोग जिस फील्ड में सीट चाहते हैं अल्लाह उन्होंने उनकी ख्वाहिश के मुताबिक उन्हें सीट अता फरमा और दुनिया आखिरत में कामयाबियाँ और भलाइयाँ उन्हें अता फरमा और अपने शोबे में बेहतरीन खिदमत और हक़ अदा करने की हम सबको तौफ़ीक़ अता फरमा हमारी कोशिशों को कबूल फरमा और हमें जन्नतुल फिरदौस में आला मुक़ाम अता फरमा सुब्हान व बिहम्दिही सुब्हानकल्लाह व बिहम्दिका नशहदु अन ला इलाहा इल्ला अंता नस्तग़फिरुका व नतूबु इलैक रब्बना तक़ब्बल मिन्ना इन्नका अंतस समीउल अलीम व तुब अलैना इन्नका अंतत तव्वाबुर रहीम रब्बि इग़फिर वरहम व अंता खैरुर राहिमीन सुब्हान रब्बिका रब्बिल इज़्ज़ति अम्मा यसिफून व सलामुन अलल मुरसलीन वल्हम्दुलिल्लाहि रब्बिल आलमीन.
Assalamualaikum. Just one last announcement. There is a QR code here. I request you all to please scan it by your phone and you will have a knowledge about what DARE is really doing and also you will have an opportunity to become a member. And another announcement is please enjoy the snack outside kept for you before leaving. Thank you very much.